All right, we are going to once again change the agenda and see if maybe we can hear the Attorney General's report at this point. Allow somebody to bail on us.
I mean, I just have to go back to the office. I'd rather stay here.
Okay, well then sit back down.
So you should have the report, I believe, in your SharePoints. I'm happy to answer any questions. I don't think there's really any significant changes from the last report that you all heard in October. The numbers are pretty static, other than that we have been closing cases. But I don't think there's any major differences from October. You have 9 administrative complaints open and 1 cease and desist, which you just handled today, that one. So I'm happy to answer any questions.
Well, I'm glad we let you go early. You know,
Yeah.
that's it. Make you wait for that.
No, you're fine.
Any questions from the board? We do have the reports in front of us, so that's a positive. So I appreciate your time today.
All right, thank you. Appreciate it.
Thanks. Have a good rest of your day.
You too.
All right, let's go back up to continuing education. And we're having some CE on the cornea. Comments or thoughts about that? Looks like it's a lot of information. It's a 7 p.m. on the 19th of February meeting. A fairly new board certified ophthalmologist, it looks like. I think she got her DVM in 19, and so then went through additional training, and now I think she's actually, is she practicing with VCA?
I believe it's what it's like.
I thought that's what it said.
Yeah, I think so too. So lots of information about the diagnosis, the treatment, when to refer, that type of thing. Melting ulcers, infected ulcers, simple ulcers. Thoughts?
That looks good to me. Anything that's taught by a board certified specialist, and she's got 2019's recent, but not that recent.
Oh, I
She's got
understand.
5 years under her belt. So.
And her more professional training
Got
after
it to us
that.
before they actually gave it.
What's that?
She got the request into us before
Well,
they
that's,
actually gave
I
it.
know that's odd, but we have the
Yeah,
chance.
I would
to-
make a motion, we approve that C.
Seconded.
Great, we have a motion and a second on the floor. Let's vote on it. Dr. Clemente,
Aye.
Dr. Schnarr,
Aye.
Dr. Sunbury,
Aye.
Natalie,
Aye.
Ashley Selke.
Aye.
And Dr. Peelman,
Aye.
and myself, Dr. Rodenbarger, aye. Okay, great. Okay. We are at discussions. And do you want to start with this?
Yeah, I think Gary's going to do
Oh,
the
Gary,
legislative update.
awesome. Thank you.
Thank you, Mr. Chairman, members of the board. I'm here for Sarah Simpson, our legislative liaison, who's downtown. The House Agriculture Committee met today, so to hear some bills and just give you a brief legislative update on some of the bills the Board of Animal Health is keeping track of. I think just from the standpoint of the agency itself, we had a couple of initiatives. One directly relates to this board, and that's to make additional changes to the statute that will allow the criminal background check information to flow to the director for approval of licenses. That bill's been introduced. We think it will be heard next week hearing, so that's moving along. The other initiative was for a state-based student loan repayment program for veterinarians and veterinary technicians. That was wrapped up in the budget process. The budget bill, the introduced version of the budget bill has been introduced in the House. And there are no new initiatives in there from the Board of Animal Health, so that was not approved, at least for the introduced version of the bill. So the agency had a number of requests in addition to that, and none of those were approved. And in fact, the agency's budget was reduced in the introduced version. So those are the bills that directly relate to BOA. Some of the other bills that we're keeping an eye on, there were some bills heard today at the House Ag Committee. One deals with the adoption of research animals, so would require animals that are have been through a research trial, if you will. At the end of that trial, unless there's a health or safety reason not to adopt them, they would be required to be offered to either the public or the shelter for adoption. It's my understanding that bill passed out of committee this morning. There's a bill introduced dealing with animal blood banks, which would require the State Board of Animal Health to establish standards for the operation of animal blood banks in the state. I don't know if that bill is going to get a hearing. We have not heard that it will at this point, but that's been introduced. And I have the bill numbers for these if anybody's interested. But, in addition to those, there's a bill dealing with a number of different things with the horse tracks, but one of those provisions deals with veterinary medical records. It would require that veterinary medical records about a horse that the Horse Racing Commission is investigating be provided to the Horse Racing Commission, and even without the consent of the animal owner or animal custodian. So that's, I don't know that that bill has gotten a hearing yet. I don't think it has yet, but that's a bill that's in the session currently. And a bill I think you're aware of dealing with allowing lay people to conduct teeth floating and chiropractic on horses at the horse tracks. That bill was heard this morning. I've not heard how that went in committee this morning. I know the IVMA was involved and was going to testify. Bo was there to answer questions if there were any. Sarah's not back yet, so I haven't heard how that went. Those are just a few of the bills we're keeping an eye on that thought you might be interested in. So if you have questions, I'll try to answer those at this point.
I talked to Dr. Phil Morse last night. He's the head of the Racing Commission.
Horse Racing Commission.
Horse Racing
Chair.
Commission. I did not realize that there are several horses at each track that stay there year-round. I mean, I thought they just come in and do their races and maybe leave, but no.
I think particularly at Shelbyville.
Yeah, there's
Yeah.
about 1,000 at
Yeah, they have
Shelbyville.
like 1,000.
A little over 1,000.
All the time is what we were told.
1,000?
A few more than several.
Well, he explained to me why they don't want to put them in a trailer and take them to an equine practitioner, because he said they don't know what drugs will be given to them. I guess in the stalls they got all kinds of cameras and everything, and they watch everything. And we've had a couple instances in here where, you know, the veterinarian, the Racing Commission is extremely aggressive, you know. So they just don't want to take them off. They've got them there, they're going to stay there. But they can't get a veterinarian to come.
Well, we're going to discuss that more under discussion.
Well, this is discussion.
Well, but not under legislative update necessarily. Huh?
Okay,
Is all. So
That
we
was
just
just-
don't need to detain him if,
Unless you want to talk about.
unless you want to speak to that.
Well, it's up to you whether you want to talk about that issue now or later, so it's still up to you.
Well, we'll shift right into that. It kind of goes with beamer therapy and alternative medicines and things that Paul's been talking to folks about.
And Brittany and Sarah
Myself, to a
Simpson
degree.
attended a meeting with a legislator downtown where the Horsemen's Benevolent Association was there and explained the rationale for the bill. So I guess Brittany could update you on how they presented that. They thought they might come today, but the bill's being heard today, so they're probably down there testifying, so.
Do you have any other updates?
No, that's just that.
So if you want me to go into.
Yeah, we can
whatever you
segue
want.
right into that if you want.
Okay.
John already started that ball rolling.
Hey,
Thinking to go.
I appreciate it. What I found out at the meeting. Do you need to take a break?
Just, no, just real quick, I just texted Lisa Perius about the bill this morning, just now to see if she had an update since we haven't heard, and she just said it passed out of committee 9-3. That's all the more I know. But
Yeah, I heard all the bills had passed, but the website, the other one showed a vote, but that one didn't show a vote, so I wasn't sure what was going on.
9-3. Whatever that's worth.
And that wasn't, the bill wasn't modified at all,
She just said it passed out of committee, so that's,
because I know
Very
that
basic.
there was, for
Do you
Paul's
want to explain what that
commentary.
means?
Yeah, I think there was an amendment, but I think, my understanding of the amendment was all it did was change it from the Horse Racing Commission shall to the Horse Racing Commission may issue a permit to do this. So it didn't change a lot.
Okay.
So the meeting that we went to was with, it was the size of, the room was the size of this table, and there were 11 people in there. Mostly people, mostly horsemen. They were all very helpful with trying to help Sarah and I understand the problem. And it's, I mean, they have over 1,000 horses over at Shelbyville. They're about 1,000 race horses, and then I think they have 40 horses that they use to exercise the race horses. They have, at that facility, they have 1 or 2 veterinarians who are licensed to be at the track. The track, because it's through the Horse Racing Commission, you have to have a special license to actually physically go onto the track and work on an animal. They have, so the licensed vets there do not do the equine dentistry. They have 1 outside veterinarian who will come in and do just the dentistry at the track. That vet is only able to do about 10 horses a day. And she doesn't come every day. So there's a lot of horses that need to be taken care of. And they explain that because these are race horses, they typically do their dental floating at least twice a year. The dentists come in, they do sedation, they charge quite a bit more. They use power tools instead of hand tools. So there is a cost aspect to all of this. It's like $250 versus $90 or $95 with a layperson who has only hand tools. My understanding is that the lay people they use are also very familiar with horses, maybe at Churchill Downs, and just kind of have a circuit that they would be willing to include Indiana in. They would only practice at the track. There is, in addition to what Dr. Schneider said about the not being able to see the horses and maybe what is happening to them off-site, transporting them also invites illness and injury when you're moving them. These are $20,000, $30,000 animals. They don't want injured. Yeah, I mean, it can be, yeah. And that is only the folks at Shelbyville. The other horsemen who were there at the other sites, I think there's 2 other sites, they don't have anybody at all. They can't find a single veterinarian to do it, period.
That's the track in the Anderson.
There's 1 in Anderson, and so there were 2, I don't know if there's another site or if it's just another breed.
So 2 sides.
Okay, so then we have maybe thoroughbreds and.
So Anderson made
There were,
it.
I don't know horses, so I apologize for that.
There's 1,000 horses. You see 1,000 horses now.
At Shelbyville.
looks to me like if they got one veterinarian there, you ought to get about 3 or 4 registered techs and work the problem or take advantage of the opportunity. I mean, this is,
Well, one of the problems, they said that they previously had, they called them vet practices. They previously had at least 3 vet practices. So they were able to provide more care because there were just more vets on site willing to work with people for the direct or the indirect supervision of these people doing the dentistry. But right now you only have the 1 or 2 vets and they will not supervise anybody else. So that's part of the problem, is that they will not agree to have RVTs come in or even lay people come. Because right now they could have these equine dentists who don't have an actual veterinary degree or an RVT come in and do it, as long as under the direct supervision of a veterinarian. They will not do that. Now, that said, that's from the Practice Act, they could do that. There may be an issue with the Horse Racing Commission that wouldn't allow that as well. So in this bill, the bill does two things. One, they're asking the track to license these people to come onto the grounds and provide this treatment. Because, like I said, even the veterinarians have to have some sort of commission license to even come on the grounds. It's a statutory requirement. And one of the other problems that they have is they can reach out to vets, but the vets who may be willing to do it want nothing to do with all of the Horse Racing Commission rules and requirements because it's so tedious and cumbersome that it's not worth it to them. The other thing that the bill does is it doesn't necessarily change the Practice Act with respect to what is the practice of veterinary medicine. It creates an exception for licensure. It's in the same category as the vets at Purdue, if they're faculty, do not have to have an Indiana license to practice medicine up there, right? So that's what this would do, is it would give the exception for the folks at the tracks. It would accept them from licensure. Does that make sense?
Only the tracks.
Only the track.
Yes.
So
Now, the
other
bill does not specifically say it that way, so if it moves forward, that's something that would maybe need to be outlined a little
this is
bit
a
better.
slippery slope thing.
Well, it is, but the reality is, and Paul and I have talked about this, that there are not enough veterinarians to do dental floats anywhere in the state, not just at the track. I mean, I do manual dental floats all the time. I don't use power equipment, I do manual floats. It is not easy work, and the average dainty RVT is not gonna cut it. No offense. But
Hey, I can remember.
that's not gonna happen. So veterinarians that, as limited as they are, they don't want to do it, but by golly, they don't want anybody else to do it. And so that's just not good logic,
I got an
you know,
idea.
in my mind.
dental float.
You go back up to Shipshewana and you get that flyer that you're always picking up. Bring it.
I got a job for you.
Well,
I was just there 2
and
weeks
well-trained lay dentists can do a tremendously better job than a newbie RVT. And
So yeah, if you compare newbie to,
Or veterinary.
or
Or
anything,
newbie veterinarian, exactly.
we're always gonna be in comparison to the newbies as opposed to there are skilled people out there. It's always about mentorship, like we'll never win the fight if you're always comparing against the newbies. You know, you want to say?
I understand, but I also know how hard doing a manual float is.
Sure.
And to put an RVT in there to do it,
Oh.
especially, unsedated racehorse. I mean,
Are there a lot of,
That
seriously,
sounds-
are there a lot of
I
RVTs?
think the
Nutty
hardest,
to me.
hardest thing
But
that
are
I
there a
can
lot
do is
out there
float
doing?
one half of the mouth.
How does Kentucky do it?
I don't know about Indiana. I just know this kind of rule passed in
Sounds like they got
another
people who
state
can come
and
in
it
and do
highly
it.
affected them.
Well, I think
Bigger
Kentucky's
business
doing
down
it the
there.
same way that Indiana's doing it right now.
Which is
With this exception,
No,
without
Yes.
tax only?
It's-
Well, I was curious because you
Well,
said this,
We're not entirely sure. We think they're just dealing with it by ignoring it.
yes.
In other words, not enforcing the law.
well, exactly. Northwest
Didn't you-
Indiana,
didn't you
there's
say
half a
there were
dozen equine dentists out
Yeah,
there.
isn't he always bringing us the
Potentially use
articles
people
of
from
the-
Churchill down to
Yeah, all the
Louisville.
time. But
From that
who can
area.
complain
yeah.
because
That's
I don't, my schedule's
Oh, I know.
full.
And that's.
I don't have time to go do
Yeah, but there's no,
But they must
30
have-
other
they must
horses a
have
week.
exceptions.
I mean, I just don't.
Are these people
You
like,
can just turn a blind eye.
they become specialized by just doing, do they take like classes?
both.
That's another thing the bill does, is it establishes the qualifications, and the only qualification in the bill is that you have prior clients that verify you do a good job,
Or licensed, or,
or a license from another state.
And didn't AVMA have a stance
Prior client
against
thing seems a little sketchy.
the equine dentistry school that
I'm a
like,
consumer, remember how my.
I heard about it, that they get to,
They would have to do it illegal.
they
Yeah, I
train
guess
lay
you can,
people,
yeah.
not
Yeah,
any kind of
resource
technicians. And I remember being it brought up in government relations with AVMA and NAVTA.
it does, so the AVMA does recommend that a veterinarian do the dental floating. However, they do carve out a caveat that if the state allows appropriately trained veterinary healthcare workers to perform the teeth floating,
Good use of language there.
then they can perform non-surgical oral and dental procedures only under the direct supervision of a licensed veterinarian in accordance with state regulations.
Yeah. I was always taught as a veterinary technician, even when I was in school, that this is something we advocate for to not be taken away from our skills.
There's no argument that that's the stance of the veterinary community. I'm just saying, the
There's not
veterinary
enough vets in the
community
veterinary
cannot
community.
provide the service.
Now, there are some other states that have legal non-veterinary practitioners, if you want to call them that.
Mhm.
We have that list. There's
I think
handful.
Texas and Oklahoma both.
I think it's Oklahoma that told me that.
Arkansas only requires for teeth floating that they provide 2 letters of recommendation from clients who have previously employed the individual practitioner. There's,
I thought Texas had an actual school.
they do,
And they-
there's a school here.
And their graduates are allowed to.
Sorry, I know you mentioned it earlier. You said the language in the current bill is vague over if this would apply to just the commission facilities versus a change just in Indiana at large.
Yeah, so if you, it's on the very last page where it's providing for the exception. It says, so those persons who are exempt, paragraph 13, an individual who is licensed by the Indiana Horse Racing Commission and performs only the services for which the individual's license allows. So in their minds, because they're licensed by the track to be on the track and to work on the track, they're only allowed to do it on the track. That isn't flushed out in this, and so we would have to maybe propose rewriting that to say that they're only allowed to perform on track grounds or something to that effect.
Or if you didn't, the argument would then be, if they have that track license, but they wanted to offer that service in rural northern Indiana, they could go do that.
Or just be like, bring your horse to the track and I can do it.
Well, I would have to see what the track license actually says, because I don't know.
Yeah, the
It
track
may
license
say-
limits where they can. Interesting.
Well, the other thing is, unfortunately, this bill, they slid the word chiropractic in there.
And they
That
too.
too.
So I proposed to the IBMA, I mean, I talked to Lou Belch quite a bit the other day, and he said, Paul, we're gonna lose this.
Yeah, if it
I don't
passed
want to throw
9-3
Lou under
today.
the bus, but he said, we're gonna lose this.
Yeah,
If we don't work with them somehow. And so Lou and I were talking, I said, I think our membership would find it a little easier to swallow if we could get chiropractic out of there. And it would be limited to the track premises only and keep the hand float only, no sedation only. And we also thought we might throw the caveat that they have to have an endorsement by a licensed veterinarian. So if they got into trouble, they had someone they had to go to.
Yeah, and I proposed during the meeting that maybe adding, if they found some sort of lesion or some other defect that needed to go to a veterinarian, that they had to refer to a veterinarian within 24 hours or something like that.
They're gonna have a hard time if we tried to force that endorsement by a licensed veterinarian in there, it won't go far because there's very few veterinarians that are gonna stick their neck out.
Well, that's the problem that they already have now, is they can't even get anybody.
But endorsing someone and directly supervising are two different things.
Sure.
well,
Still don't want you.
the other, if you get, what, five endorsements from people that say you've been doing a great job.
Just trainers.
They've been practicing veterinary medicine, licensed.
Right.
The other half of this, more than half, is this is a huge, I did not realize the number of horses, and even from the 2 or 3 cases we've seen in here with equine veterinarians getting in trouble with the racing commission. What was the one guy, he didn't label
Right.
a vial, and then the guy that was sitting back here waiting on something else, he said, oh yeah. The horse racing commission is extremely vigorous
Well,
and I guess I can almost understand. I didn't realize that there was horses that lived on the racetrack.
well, the one female veterinarian told us she's done. She's no longer going to the track because of some mislabeled bute was in a paste and it can stick to the wall and the horse can test positive and all this. They wouldn't let her use compounded bute. You remember that?
Yeah,
And she said their brand bute, they spit it out, it hits the wall and they rub up against it and they test positive and they get disqualified. So she said their regulations not allowing me to use the compounded bute to avoid that, I'm done. I'm not going there anymore. And then the guy that followed her said, oh yeah,
that's a lot.
they're having a hard time finding track veterinarians because they're so stringent.
Mr. Chairman, I have a question. The legislator that Brittany met with is seeing this coming to the Senate. And it essentially asked BOA, when it gets over here, I'm gonna need your help with what to do with this. And so I have a couple of questions for the board, so when we have that meeting, we kind of know where you all are. And one is, the current bill has, if there's gonna be people doing this, they have the Horse Racing Commission issuing the permit to do this. Should that be this board instead? And then the same question with the qualifications for people to do this. There's a couple things we talked about in the bill, but should this board be involved with establishing qualifications for people to do this or overseeing it or any role in that? Or would you rather just say, we don't want to have anything to do with it?
I think we have to take a more or less hands-off approach because we don't have any way to police it.
That
That's
would be
my-
through the Attorney General's office like you do with any other
Yeah.
licensee if it was established that way.
But
Well, I think that's what he's saying is, should it be more of a permit through this board
right.
to police it?
If it comes through, we only have the power right now to discipline veterinarians and RVPs.
Well, this would.
That's the question.
So do
You're
we
right,
want to,
create a credential that we
what I'm
oversaw.
saying is, do we want to expand our
That's what I'm
powers
asking you.
to police lay people? And I'm thinking that would be a nightmare to try and do.
Well, they wouldn't be late.
They would be credentialed
They
by
would
our
be
board.
permitted by our board.
Right.
It'd be another version of a license.
So we would have a license, we
A
could
third type.
suspend or put on probation or.
Well, but they still are lay people. They're not doctors or registered
Correct,
veterinary
but-
technicians.
But it would be, I mean, it would be a certification, a permit, a registration that
It would give
Would
us
be
an
created.
opportunity, yeah, to be involved.
The other issue is how do you assess whether they're capable or not? Now, the comment of,
The former clients.
right, and let me tell you how that works. They watch their horse having their teeth floated, horse tolerates it, person gets in there, grinds. The other side, same thing, says, oh, they're great, you're good to go. So the owner says, that was awesome. They could have left half of the points in there. They could have missed a broken tooth. Lord knows what maybe they saw, or didn't see, did or didn't do. It's just that the trainer said, horse tolerated it, seemed to do okay, must be a good person, so.
Didn't cost me as much as it would have if that
Didn't
vet
cost
came
as
out.
much.
Right.
So that's a challenge in and of itself, how you determine whether they're qualified or not.
will you
Unless
give
you
them a,
put a mouth speculum in there and go in after they're done and look and check and assess what the mouth looks like. I mean, and that is a lot of policing right there.
well, but then you also create a new credential and require that they graduate from a certain equine dentistry program. In
Yeah,
order
if we
to
And I'm much
created-
better with that
we
than
created
the
a credential,
concept of getting an okay
theoretically,
from
there
3
would be
trainers who
input
give a
on
thumbs
what
up.
you have to do to
Well, they're
attain
not
that.
What
gonna-
the board would establish.
They're not gonna
Yeah.
give you 5 names if they don't say the
Oh, no, they're
guy's
gonna go for
perfect.
Well, one's his cousin and the other one's his,
I don't even want to bring it up.
I mean,
neighbor down the street.
Training.
Does the board, what's the board's tolerance for a new credential? That was a question.
Well-
He doesn't want to bring something like that up if there's no
I mean,
tolerance.
it's kind of
here for
already in the
overseeing.
discussion, because that's the way it is in other states. Like, in other states, they say the qualifications are this or that, or as determined by the board. I'm that kind of.
I'm leaning toward Paul. on
I
this.
don't think we
Staying out of
need to get,
Can I provide the board director's view on what
Please.
this will do to me specifically? When I get to my report, you'll see that I have filed 3 unlicensed practice complaints with the Attorney General's office. 2 of them are for equine dentistry of a layperson, not at the track. As previously mentioned, Dr. Clemente filed 14 of them from Northern Indiana. I think last quarter I filed a couple against lay dentists as well. We get them all the time. If this goes through the way that it's written, and not that we can stop it, I'm just saying, if it goes through, I will be getting calls all the time. 1, how do I get licensed at the Horse Racing Commission, which I'll have to transfer there. And also, why can they do it at the track if they don't have any other credential other than they got a letter from 5 people that said that they can do this, when I'm up here helping all of these farmers in Northeast Indiana do it. And then those people are actually being disciplined with a cease and desist and an injunction, and it's actually a criminal, it can go into a criminal matter, it's a misdemeanor. So this isn't going to be solved today, but I do think that when we move into rulemaking and possible statute changes, that this is something that the board does keep in mind, because allowing them to do it at the track is not up to anybody in this room, right? But the bigger picture is if we can credential people and have them doing it the right way, or at least having the education, we know that they have the education behind them. It is something to consider in the future. And there are at least 4 states that do not consider handheld floating as the practice of veterinary medicine. And those are Florida, Connecticut, Maryland, and Vermont. So they completely changed their Practice Act to exclude handheld dentistry. Like in the Practice Act now, equine massage is excluded from ours. That's something that could be done too, and then that solves the problem at track. and in Northeast Indiana and Evansville and anywhere in Indiana. Those are my 2 cents for what they're worth.
I just, from the top of my head, when you say those states, like Florida has 2 credentialing bodies. It's the only state that has 2. And they don't have any parameters for credentialed technicians. Also, Connecticut is the one state that has no credentialed technicians. They don't even mention it in the Practice Act. And then that leaves Maryland and Vermont. So like technicians are a huge part of helping with this procedure under DVM supervision. And just off the top of my head, there's those 2 states stand out of my own. I would have to look up Maryland and Vermont, but they lack a credentialed technician presence in those. That's just what came off the top of my head. To help them with those procedures.
Doesn't often come up,
But they
I'm
don't
here to
even
provide a
count it in
consumer
those
member
states.
perspective.
Yeah.
Yay, you go.
And I'm just saying, from a consumer member perspective, when you talk about this credentialing, or the feedback from the vets, and I think a bill that just went into effect July 1st, is that Indiana has a lack of practitioners, and as a result, there's a lot of stuff that goes on because there's not really other ways. So like, one of the bills last year was that we can renew a license after it's been expired more than 3 years. I think the intention was behind that was like, we don't have enough vets, so if we can get people who are willing to come practice here, there's something behind it. From a consumer perspective, it's like, is there an option where this is something that can be provided? It sounds like if they want it provided at this point, specifically at the track, it's not really something you can get. So what are your options? You know, like, how do you go about solving that? And it's a lot of underground right now. And theoretically, at least considering an option like this is something that then at least it's out in the open and the board does have some input and can put some restrictions in place or be protecting the public and animals in a better way than they can by just trying to essentially shut the whole thing down. Where if the demand is there, consumers are gonna go find it regardless of what we do from that perspective. I guess that's my question is like, if the demand is really out there as it seems and there's really that lack of care to provide, I think we have to at least creatively consider if there's a way to kind of bridge that gap a little bit.
Piggybacking to that, if we think we're losing this vote and that this is going to happen, I'm very against the 3 or 5 recommendations from somebody whose teeth I floated, but rather schooling somewhere. I mean, you know, whether it's go to Texas to the school and then come back to Indiana or whatever it is, I would try to require that the lay person at least be a graduate of some school. They're not a doctor, but they've at least gone to school.
There are a handful of schools, and I don't have them all memorized, but I know that Minnesota's statute allows for equine teeth floating if the person has a current certification from the International Association of Equine Dentistry or other professional equine dentistry association. And I know on their website, they have a list with links to the schools. I found it while doing the research on this. So the schools are out there. If it were to be something that the board would consider over time changing, you know, you can make it as simple as current certification from this international association or from a very specific school or a list of 3 schools, just like we do with the RBTs, right? We accept anything that's accredited by the AVMA, but there is that list and there's 3 of them in Indiana, right? So it would be similar to that.
See, as far as I know, AVMA doesn't accredit any equine dental schools, as far as I know.
Sure.
So we don't, you know, we have that safety factor for us, for veterinarians and veterinary technicians, because they have to graduate from an AVMA accredited school. So how do we know that Billy Bob's horse dental training program in Abilene, Texas is a good one?
Well, I think research needs to go into it, but at the same time, these are very expensive horses. They're not letting a random person do it. I mean, this is, yeah, they're not veterinarians, but these are not people they're finding and say, hey, you want to try, be floating at the gas station,
Right.
it's,
I understand what you're saying, and that's why I thought a compromise where the horse racing commission limits this to the track only and eliminates chiropractic and leaves us out of the loop and makes your job less tedious was probably the way to go. But, we're in some ways kicking the can down the road a little bit. I mean, we really are. But we don't have, how do we accredit it, or how do we verify schools as to whether they're good or not good and how good their training is, and that sort of thing? That's the problem.
Dentistry Association.
yeah. Well, it's the
Yeah,
international,
so is that a good
Association.
program? I don't know.
Well, that's a school. Is there an association that
no, it's
represents
the
it?
International Association of Equine Dentistry.
Yeah, so,
That's the association.
and they've accredited these different programs.
I don't know if they've actually accredited the programs. I just know from looking at the Minnesota Board of Veterinary Medicine that they had a list of programs on their website that were
Somehow approved.
approved by them. And
They paid enough money, or they actually
Which is
improved
interesting, because
themselves.
obviously it seems like no states
Still
are,
gotta be better.
everybody's all over the
We
map.
have a
Yeah, I
case,
Having 5 neighbors.
years ago,
say
it came
they
through us
floated my
that
teeth, horse's
they
teeth, and they
went
were
I know what
great.
you're thinking.
I don't remember the
The
name.
guy's name was the Tooth Fairy.
Very, yeah.
The Tooth Fairy was not only floating teeth, but he was teaching people how to float teeth.
I guess,
He was advertising a school. And we shut the Tooth Fairy down. He came before us twice, and
Okay.
he got a cease and desist, and I have not heard about the Tooth Fairy for a long time.
Yeah, and this association, it probably just approves them, like NAFTA approves, approved veterinary assistant programs. We don't credential them, but we approve them with they have to pass a certain criteria, and then they can be approved veterinary assistant programs, but we don't credential them. I assume that's what this international.
I guess the other perspective is that bill already passed out of committee, and you may or may not have any opportunity to
So-
have your opinion.
So that's what I was waiting. Lisa got back with me again, and she said, it's gonna be tough to defeat, but I think we should have an opportunity to amend the bill to create some regulatory structure, so stay tuned. So this is why this conversation is
That's what
very
I said.
important.
Right, so the question then becomes, do you want to be involved in the regulatory structure, or do you want a horse
Horse racing.
commission and simply stay completely out of it?
So there's something else to consider is that whether this is an exception to the practice of veterinary medicine or not, the track is still going to have to license these people, right?
For their purpose.
For their purposes. And that's what this bill does, is it allows the track to license them with either some sort of other licensure in another jurisdiction or with these letters. It still has nothing to do with how good they necessarily are or anything of that effect. And that's where I think this board has the opportunity at some point, like Natalie was saying, is to be a part of it and make sure that these people are providing good care to to horses.
To be able to help protect the horse and the public.
And the horsemen that I met with, they're trying to do the right thing. They have these horses that they're, caring for. They want them to be healthy. They don't want to take them off site if they can, because it is dangerous. But
I
You know,
don't think
they're
it's a
stuck.
danger. I think it's, what are they gonna inject into them that'll make them better racehorse? That's the illegal substance type
well,
thing.
that's the tracks issue.
Yeah,
The veterinarians are signing off though for the horses to leave the track. They just won't sign off on an RVT to do the floating because they
this
don't want
is
anything
a
to do with it.
huge, bigger
It's a big problem.
bigger issue than what I even imagined. And I think from the track standpoint, they have to protect their interest, or whatever that is, which is keep these
Well,
horses.
Dr. Vorse was somewhat offended when I suggested the Horse Racing Commission may be backing this bill, and he's like, no, we're not backing it. So, they're trying to, they're kind of having it both ways. We don't back this. But yet, if it gets passed, I guess we'll have to enforce it or supervise it. So. Because he's president of the horse racing
They also
commission,
benefit from it.
and he's a big part of the IVMA and our struggles in the past to
Well,
I'm
Pose.
just curious, because it sounds like the train has left the station where all you would like to get on it at.
when it comes to the track, you're
No,
correct.
when it comes to the track is the way it currently is, but I'm saying, once that door has been opened and people are doing this, as she said, she's gonna start getting those phone calls. If they can do this at the track, why are you sending me a cease and desist? And it's going to get very muddy and it's gonna create a lot of work there. So
Yeah.
my question is the board just gonna say, we're gonna wait this out for 2 years and see if those calls do come? Or do you wanna be proactive and when this is being formed, at least pitch the idea that they might consider it, and they might still say no on that, but do you have any thoughts on that?
You're
When I'm saying that the train's already left the station though, so like the arguments for all and against it are kind of like, it's now like, do you wanna get on board at this point, or are you just gonna go totally hands off?
Well, you're 100% right about, it's not gonna stop
No,
with the track situation. And quite honestly, if we're supposed to be Switzerland, we're supposed to be objective and neutral, we theoretically as a board should, I was told a long time ago I couldn't testify as a representative of the Board of Veterinary Medical Examiners on a bill.
well,
I could testify as an individual veterinarian,
we're
but I
appointed
couldn't.
by the governor and therefore would be speaking on the administration's behalf.
But-
That's kind of how
but
I would
you're
read that.
not
So
being
unless they've
asked-
said that you can do it.
You're not being asked to testify.
Yeah, the agency is neutral on the bill,
Yeah.
Right.
but we're getting questions about, can the agency do this? What do you think of this? And we try to answer those questions. This is what, so when they went to the meeting, one of the main goals was to make sure people understood what the current law was. This is what can currently be done. And then we always say, if the General Assembly wants to do that, we can do it as long as we provide the resources. That's always the answer. But I just,
Budget cuts and additional credentials.
yeah, there you go. But we just wanted some input from you to say, if this idea comes up and then someone says, well, it really ought to be the Board of Veterinary Medicine doing this. We can not have any comment and say, okay, if you want us to, we can, or if you had strong opinions one way or the other, we can, express those, but, because we are being asked, and we wouldn't, not as a testimony at the hearing, we go to be there and say we're neutral and answer questions, but outside of the hearings, I mean, they've already said, when it comes over here, I'm gonna wanna talk to you about how we're gonna fix this, or what we're gonna do with it, or whatever.
Well, this Bo Beard that's backing it is a quarter horse guy. And he races them, and I'm sure he has stables somewhere. So,
Well, one of the things that Brittany brought up was, we have records of cease and desist that we've handed out. So if they want to sue this board, I guess we'll have to turn to Clarence and say, you have to protect it.
That's what, can we take a vote? I'm just curious to get everyone's feedback on, would you entertain the idea of the vet board being a part of the credentialing process for equine dentistry practitioners, or whatever these people are, or not?
With requirements.
Yeah,
For certification or
Being
whatever.
the-
like graduate.
It would become a credential, so there would be a full process behind that, but that's the main question I think is you're trying to get to is, if someone's asking them in a meeting, is our board willing to be engaged and involved in this process, or are we going to say, we don't have,
The Horse Racing Commission can just do that
Yeah.
with the tracks.
and again, not that we get what we want.
I
in
don't
this
think you can
situation,
say
but
that because,
curious.
as you had indicated and you did, it's going to extend beyond that very quickly. And so we'll still have to deal with the rest of the state somehow, either by prosecuting them or something. So,
Alternatively, you can, and maybe not this session,
Yeah, because that's really almost an IVMA question. I mean, this session, do you want to keep it at the tracks only, or do you want to try to address the bigger question, or is that down the road when it comes up again?
I know whatever we decide, the veterinary technician community will take it, if you make a new credential, they will take it as you're taking a job away from them. That's what they will see it as. there.
How many of them
But
have
they're
a
not
job
there
doing
right now,
that as it
doing that.
is?
I don't know specifically that, I just know there's 2190 registered veterinary technicians in the city.
Is that something that RVT can currently practice, do unsupervised? Or
No.
does it still
No,
require
not
supervision?
unsupervised,
No.
but if these DVMs aren't letting them perform it under
Well, theoretically, if
supervision-
there is a new credential, any RVT could go out and probably be a really marketable resource to be getting that new credential and then be able to start their own business if they wanted to.
I think
That
if we
much higher
promoted
than
it
the average,
that
too.
way, like if it goes that way, be like,
But if
This is an
the
extra
track
thing you can get,
veterinarian
then it
doesn't
would be
even
different
want
than just
anybody
saying, oh, we made a new
to come
credential.
on and do it, he won't do it. or they
We
won't
teach
do
it at Purdue to
I mean,
veterinary
we're up-
technicians.
Well, no,
So
in this
theoretically, it could
situation,
unleash an additional practice because then you could it could add something that
they don't
RVTs
have to
could do
have veterinary
unsupervised.
supervision
Yeah,
So Steve.
I just know
under this.
if we don't say
They
anything
take
about it,
it.
they'll
Oh,
be
yeah.
like, they take
But
something
I
from
thought
us.
they
But
did
an
Trying to
RVT
amend the
would.
bill.
Oh, yeah, I understand that.
It doesn't sound like they did, that'll be the next thing. I think she had said before,
That's the next.
we would try to do it on the Senate side. So if it passed today, which it did, so that's why we need to be prepared.
To try and
or
amend it then.
Yeah,
And we
that's my
met,
understanding.
we met with a senator, and
Is that Jean?
Lacey.
What did she have to say?
that she was sympathetic to the issue. It's a problem.
She seemed to know that it was gonna come to her.
It
That's why she had to
be
be
heard.
That's why she
Sounds
had
like
to
it
be-
did.
So she may have voted for it.
No, well, not
Yeah,
yet.
it's on the other
She's
side.
in her, yeah. It's got to pass all
Yeah,
the way.
pass out of the
But
house.
she's anticipating, I'm sorry.
Yeah, yeah.
She's
She's
anticipating.
anticipating having to
Having
vote
to.
for it. That's what Lou
Have-
said.
Having come to her committee,
Right.
Yeah.
she's
That
the
she was gonna have a hard time
She's gonna have to do something.
not supporting it.
She's gonna either have to kill it or allow it to go forward or whatever.
But I thought the comment was she was gonna have a hard time. Greg Kurt sent an email saying she told him she was gonna have a hard time opposing it.
Well, we have to get back to the task that has us on the board anyway about protecting the public and animal health. So if it's happening anyway, and there is no way right now to make it stop happening, short of arresting half the state because they're trying to meet a need, and we put together, I mean, we can, I don't know, can we find a couple of connections with the racing commission or something to have a little subcommittee to say, these are the places that seem to, I mean, because surely they have, like vet schools have graduation rates and how much money their graduates make, and surely there are professional, really good places that have information because they're gonna wanna tout their success with their graduates, and we just make a list. And these are the places that we're accepting right now. And that's open to change based on the boards. Like, we do lots of individual exceptions, we could leave that open.
So in the United States, according to this association website, there's the Academy of Equine Dentistry in Idaho, the American School of Equine Dentistry in Virginia, Equine Dental School of Texas in Texas, Equine Ornithological Training Institute in Idaho, the Midwest Equine Dental Academy in Michigan.
And then the president of the Equine Veterinary Technician and Nurses Association, she is at Purdue. So she was interested in this bill.
Mr. Chairman, I know you have other business. I think we have enough input to be able to say to whoever at the General Assembly that the board's aware of the issue. With the current bill, the board's biggest concerns are the fact that it may not be limited to just the tracks in the current language. It really should be. And the concern is the standard or the qualifications to do this are pretty loose with just the recommendations from past clients. So those are the board's biggest two concerns.
And chiropractic.
And I would-
And chiropractic. Yeah. And so then,
I would also state the inequity of handling it throughout the state. That
yeah, we know it's a
Being
bigger
allowed-
issue that.
being allowed at the track through this bill, but still
I guess I was,
prosecuting those wanting to
I guess
go
we would
elsewhere.
say, we can see that this is going to, the issue is bigger than just the tracks, and so this bill may address that, but the issue is going to continue into the future. We may need to come back to it. And the board will be happy to participate in those discussions at a later time. And of course, if the General Assembly wants the board to be more involved with issuing permits, the board can do that, provide the resources.
What are we sending
Recommended
you?
that.
What are we sending you with regard to our stance on whether we want to be hands-off or be involved? Have
So
we
right
as a
now,
group come up with that?
I mean, right now, the bill doesn't have this board involved, and we haven't said the board ought to be involved.
Well, I thought that was one of your questions.
Well, it is, I'm just saying that we can keep it that way and just not, until it comes up, we just won't, we won't offer that.
Okay.
If that's, and again, that may be more of an IDMA question.
Well, that was,
But-
Ken, did you say Phil Bohr said that the Racing Commission didn't do anything?
I had made the mistake of saying evidently the Horse Racing Commission supports this.
Okay.
And he replied, no. We're not backing the bill. We're not driving the bill.
Well, what I'm
But
suggesting,
it's like,
Not
if you're
opposed
not
to it.
backing it, you're not driving it, but yet you're gonna,
maybe
allow
we
it to
could have
happen.
It sounds like they're neutral also.
and you're gonna supervise it. You're not backing it, you don't particularly like it, but you're gonna supervise it.
We contacted the agency because it's, agency to agency, what do you think of this? And we kind of got the same, not from Director Boris, but
Yeah.
from the staff, it's like, yeah,
And I said, well, I stand corrected. The wording makes it sound like the Horse Racing Commission backs it, and it's not. It's they're tasked with supervising it.
Yeah, it's the horsemen who have brought this.
I understand.
should the
I understand that.
IVMA,
Gary, I appreciate you trying to close this discussion a little bit. Thank you.
But
But this can go on forever. We
I
need
think
to
I would
move on.
agree to not have us jump in and say, hey, we're gonna take this over.
oh, we don't want to do that.
We won't speak one way or other to that.
No,
I
but-
think
You might
What
be
he's
prepared to
taking
entertain that
away-
conversation, because otherwise it's just gonna be really messy for a couple of years.
Well, could the IVMA?
It's pretty
the
messy
Horse
right
Racing
now,
Commission
I know,
have
but right
a
now, at least we feel
study
like we have
group,
ground to
working
stand
group
on. I
or
think it'll
something
be,
that would start looking into this?
or at least at the
or-
very least, I
I
guess,
talked to the
we'll probably
Attorney
be
General's
taking
office
Kentucky's
about it.
approach
They
was
just said,
is to just
keep the
not pay
Attorney
attention
General
to
out of
that
it,
for a
that the
while.
board wants to make recommendations. They can't.
You don't want to be
Nobody
involved.
wants
with
any
it.
of
Right.
it.
I guess we stay on
I mean,
Gary, you
this is
know
gonna
what?
get worse, so what I'm
You're
saying
gonna-
is,
Yeah.
let's get a commission together, the IVMA, the equine practitioners and the Horse Racing Commission, and hammer out some of these issues that may not take, may take place 2 or 3 years from now. And at least we've got some background study going on.
Yeah, and I think the current initiative is trying to be focused just on the tracks. And it might be difficult to try to solve the whole problem in this session, in the middle of the session.
Oh, it's not gonna happen now. I'm talking, it'd be a good summer study.
So moving forward, would you like the board director to start doing some research on these schools?
Great idea.
And we have this proposed task force that I would like for the equine veterinary technicians
I would like.
and nurses. I was like, I would be TE.
Oh, yeah.
To be in there
But
as
if you
well,
were ever gonna
just for
go-
input. Because there's some states where technicians, like in North Carolina, they can't do teeth floating whatsoever.
Oh, Google.
It's just different state by state. But I just feel, that's why I'm here, is to give the technician perspective. And so I just want to make sure that we include them.
Yeah, our colleagues, our equine colleagues with the IVMA are going to be pretty dismayed if we say, okay, we're going to now, as a vet board, start licensing or exempting from licensure certain groups within certain schools. I don't think the time is right for that right now.
Oh, I agree with that.
I think if it starts happening at the track and what Natalie talked about, we start getting the double standard and Brittany starts getting blitzed, then we're gonna have to do something.
Something to be said for being proactive, knowing it's coming.
Well, that's, Brittany offered to kind of look into these schools. I think that's a good proactive
To
step.
start, it is.
So we're kind of prepared.
But I
Because I
think it's
have
good to
no-
have these thoughts in back pocket if these conversations do happen, just as, these are concerns or things to be considering when, if you pass this legislation this year, this might happen, and, you know, is there, can we have this discussion after whatever?
And one thing to consider is that if this goes through the way it is without any other changes to, you know, the Practice Act, then we would have to repeal this I mean, we would not solve the
I
other
was saying, is this in
problem.
conflict with the Practice Act technically? Like,
Well, no, because it's exempting,
That's right.
exempting them, kind of
From
like the
practice.
Purdue vets.
Yes.
But if they're only, yeah, it's complicated, but like if they only have to get letters of recommendation, then 2 years down the road, if we're requiring graduation from a program,
And they've already
To
been
get
doing it for
licensed.
2 years with letters of recommendation?
just
It's hard to
another,
put it back in the box.
just,
Well,
okay.
that's why I said, you know, I think we ought to start looking into it and studying it, not making any decisions,
He's
but
been trying to come up for the last
everybody on.
however many years.
I don't
So
know.
the Legislative committee, so. we can call-
I did not realize it was this huge of
We got.
Are we leaving this subject?
Months ago.
Yep.
that it's-
Okay, good call.
Again, somebody was gonna bring it up. They just didn't know, and then when
We want to discuss any other alternative medicine issues, whether it be
Yeah.
somebody using a electromagnetic blanket
Well,
or
I
beamer
was,
treatment.
I was
Yeah.
asked specifically about the Beamer treatment by one of our investigators, I think. Maybe
Okay.
that Brittany or Cassie, Brittany, one of our two
So
investigators.
let's talk about it in a general.
Yeah.
stance.
So I was asked, you know, my opinion, and that's when I turfed it to you, because you're around these horse people all the time.
Well,
don't know
I think
What is beamer therapy?
Jerry can tell you. a little bit
It
about
is a pulsed electromagnetic field product. It stimulates increased blood flow and muscle treatment to try to reduce inflammation and add comfort, I guess I would say, after, I don't know, a show, after training, after exertion, that kind of thing. And the beamer, I think, is a circular device that you can put you can hold next to a certain area on the horse, like be it the shoulder or the hip or whatever, and do treatments. And they say that, and I've not actually seen it used, but the indication is that the horse actually kind of relaxes and you can see them breathe slower and just appear more comfortable after they've had it. A lot of trainers and horse owners are really positive and pro in their opinion on it, just based on nothing scientific but observation and patient response.
It's sort of like therapy laser.
Yeah, kind of.
It'd be like cold laser.
Yeah,
Yeah,
with the exception that it's a much larger device because it's mostly used for
Yeah,
equines. But they do make a beamer thing that actually a little dog can sit on or lay on, that you can put it under a
What was the
blanket
question,
or
if this was
something.
considered like practice?
What's that?
What was it for discussion, if this was considered
Yeah,
practice or
so.
like not?
Well,
Well-
if somebody's driving around and they have one of those in their car and they are being paid to go apply this treatment, then the question is, this actually fall under diagnosing and treating, which would be the practice of veterinary medicine, versus a trainer that owns one and is applying
Yeah.
it to his own horses, or that he has training, or an owner using it.
Well, it's always been the case in large animal medicine, though. Those guys can castrate, dehorn, vaccinate, do whatever they want to their own animals. It's when they start going to neighboring farms and charging a fee. And this, I'm at least partly guilty. There's a guy running around Kendallville and he's advertising it. He's treating people and animals.
Well, so I looked at their website, like it's an FDA, like there's a human version, it's like an FDA
Absolutely,
approved device that I can buy right now and use at home, so it's kind of like a weird gray area of, yeah, then if I'm like renting it out to people.
But a
And
friend,
telling them that it will give them a result versus just saying like, this is something I'm using at home.
Well, even in the veterinary realm, if you gave the device to an owner, they could use it on their
Yes.
animal.
They just.
You just couldn't,
Rent it to them.
well, I mean, I don't know about that, but you couldn't go perform the treatment yourself.
Seems
In
like
theory.
charging is meant to be providing a service, of which you're not qualified for if you charge.
That's not actually in the statute, though.
no, it's not.
It's in the cosmetology realm. It is in the statute, so I can cut Natalie's hair if we're just friends. But if I charged her for it,
You need to be licensed.
I would need to be licensed. Now, that might be separate for like if I were dyeing her hair, she might reimburse me for the cost of the dye. But the
Did
actual
you hear
service,
horse massage, isn't that exempt? Did you
Yes.
say-
equine massage.
Yeah, so.
If it
Different.
stimulate, if it mimics like hand massage,
Well, I guess I'm just trying to
So-
like, in my mind, it's like, okay, so there are some certain things like horse massage that is exempt from, like you're still like providing a service and
Yeah.
treating. Because ideally they're getting some sort of relief from it and that's allowed. So this is like very, well, what's to do with the horses?
they need a lot of spa treatments.
Where you get into trouble though with this particular individual was treating a friend of mine who since died unfortunately in a head-on car accident south of Kendallville. But I was made aware that, what does Doc think of this magnetic therapy? And he sent me a website and all, and then this guy was advertising, treating people and animals both. Evidently, in the human medical field, they don't care. They don't chase down stuff like this. They really don't.
Well, yeah, because that's like, I can go see whatever crazy functional this and that and try whatever things I want to, if I'm gonna go ask for it.
But
You're
where-
paying for it, not
Where it becomes a
your insurance or
problem,
something.
Yeah, that's like insurance has the choice if they're gonna cover it or not, but it's like, I go seek out, whatever the newest thing I've seen on Instagram is, like I can find it.
it's the same old story. This, like you hear advertisements on the radio for QC Kinetics. Don't do surgery. Don't do physical therapy. Don't listen to your neurosurgeon. Go to get QC Kinetics and you'll be playing volleyball again, even if you are 80. And that's what happens in these. This guy, I don't know if he does this or not, but he could say, well, you don't need this herniated disc worked on. Just come to my place and I'll do these treatments. You'll be good to go. So he's diagnosing and prognosing and instituting a treatment. I've always used those three categories.
Well, I guess that's my question, is he diagnosing or have people been diagnosed and they're like, can you treat with this?
But treating is
Or,
a practice act.
okay,
It's,
but not,
And if
not
that
for
was
humans?
questioned, I think if it was referred, then the doctor's notes would be enough to say this was under indirect supervision or whatever. The doctor, the veterinarian said this was probably a good idea.
Yeah, I just find this specific case interesting because if it's like offering human treatment and the medical board doesn't have a problem with that.
well, I wouldn't say that the medical board doesn't have a
Doesn't?
problem with it because some of the alternative treatment cases do get presented to the medical board.
So that's why.
It's not a primary concern of theirs.
Well, I mean,
Going after it.
as a former Deputy Attorney General, those complaints do come in. And sometimes they're taken before the board. It just depends
Yeah.
on the circumstances.
I know, I'm just trying to wrap my head around, yeah, the difference between like me saying, I want you to come provide this versus you saying, I can fix this and this is the problem, and you know, like, then I'm trusting you in a medical opinion that is not founded. Where do you?
Is it ever
like
dictated
with
by
that
whether the
chicken website.
device
Yes.
is harmful?
That one felt pretty,
Like,
like she
for
literally said,
example,
like, I will diagnose
these
and treat.
You really don't
Like,
do anything negative to the
but again, you know, like,
That's,
there's a,
there you go.
other
So-
MP, so they're still
That's
licensed.
where you're
so,
getting
like,
it.
there's MPs who have
So
practices,
massage
they're
was
like, I will do
exempted
this, this, and this, but
Because I
they
think
are
the
licensed,
consensus
so
was
the
not to
MPs
hurt
that-
anybody.
Right.
And if you've
Not familiar with
been
the
around
Human
this and some
Practice Act,
experience
but
with it, and you
everybody
feel like,
can
well,
do.
it's not gonna do any harm, then we leave it alone.
Yeah, I mean, in this
There's
situation,
like an IV bar murder.
something that could be done is, yes, it's technically a violation because they are treating the animal, and under the Practice Act, it
Yeah, I don't want
says
to.
you cannot treat without having a veterinary license, but we wouldn't do anything with that, and you could tell the Attorney General's office, we would not discipline for this. For example, the Board of Pharmacy will not discipline a misfill.
A what?
A misfill, when a pharmacist makes an error in prescribing.
Even if it's like
So I
17
think we
times.
just leave it alone.
Now that's different, so,
It's gross negligent.
I'm like, you can't count.
yeah.
then
Well, it's
there's a
because
process.
they would have 50 hearings
Yeah.
a month, you know, they meet monthly, it would be so much that they couldn't, so maybe if it were a repeated pattern, the recommendation to the Attorney General's office could be, this would just be a warning letter. Not a letter of reprimand, but a warning letter, which is, the letter of reprimand comes from the board as actual discipline. You couldn't do that in this case anyway, because the only option the board has is cease and desist, but the Attorney General's office can issue their own warning letter, and it's a kind of a record-keeping thing for them to where they've said, okay, well, we've seen this person a few times now, and they've gotten these warning letters. That said, if there's no harm to the animal, then there probably isn't any negligence that would need to be looked into.
So are we gonna give you the recommendation that if you get calls about MagnaWave or Beamer or other types of electromagnetic therapies, that we're gonna just let those slide?
Well, I think that recommendation needs to go to the liaisons,
Okay.
because they're the ones who are contacted by the Attorney General's office.
See, I don't know if there's actually, when they asked me about it, and I deferred to Jerry, I don't know if there's actually a consumer complaint involving it. Because it was just a general question. Dr. Clementi, what do you think of Beamer therapy? Is it the practice of veterinary medicine? And that's when I deferred to you. I said, well, I'm not really doing horses, so I'm not that familiar with exactly what it is. Or,
Okay. I mean, it can be something that,
but I think at this point, I'd be hard pressed. It's not gonna do any, not gonna do any harm, and there's no consumer complaints. I don't think there'd be any reason for us to encourage the Attorney General to pursue a cease and desist just for that.
100% agree. Want to move on to
and I
registered
won't file
veterinary
any
technician
either.
title protection? I know you're chomping at the
We're
bit.
gonna
over
need
that.
something new to file on after the team.
So I wanted to bring this forward and I asked Gary and him, I was like, is there any conflict of interest here if I bring this up? But they said I could bring it up to the board. And if anybody knows Dr. Elizabeth Thompson, she's with ABMA, and she was part of the Tennessee board. And so I asked her about this when they drafted this. So in the discussion is the actual letter of of stern warning that the Tennessee Veterinary Medical Board put out to the public. And basically, I saw when me and Dr. Clemente were in San Diego, I looked through all our different laws and everything in Indiana State Code. And even at the bottom of, if you go to our website, it says we have the right to fine if if any of our laws are disobeyed, basically. So this synopsis of this Tennessee letter is that they sent out a stern warning saying that any facilities like hospitals, veterinary hospitals that promote veterinary technicians, like they say for instance, if they say meet on their website, meet our 10 registered veterinary technicians, or just our 10 veterinary technicians, and then only 6 of them are actually registered veterinary technicians, and the other 4 are just laymen or assistants or whatnot, but they're not RVTs, then we have a right to charge $1,000 per offense, so that would be $4,000 to charge to this practice. So that's basically the synopsis of the letter that they sent out. And when we shared it I shared it to my personal page back in 2019, and NAFTA shared it to theirs, and we saw that it resonated and reached over 120,000 people. So a lot of technicians, on mine it showed 56,000. So it was a really important thing to technicians to do. And I actually went on different websites in Indiana looking up, like, is this a factor in Indiana? And I could find many different websites where they're like, these are all our veterinary technicians, but when they're actually RVTs, they'll say RVT at the bottom, and everything else will say veterinary technician. So it's a problem in our state that's happening. And with our protection of the public and making sure they're not being misled, I think it's an important factor. And if we're one of the 5 states that have title enforcement and title protection, and we're one of the greats out there, I think we should put together a stern warning from the board to say, if you're doing this, stop it now, because then that gives that warning, because we do have the right to fine and charge for these offenses. Because if we have one of the best practice acts for veterinary technicians, but yet people are still disobeying it, like, it doesn't matter. And so it's a big thing for veterinary technicians. They just want to be taken seriously and know that their state board is there to protect them as well. And with the high numbers that we have about 2,200 registered veterinary technicians, about 2,700 to 2,900 veterinarians, I believe. And so we have, that population that's up there with the veterinarians, as opposed to different states. And so I just think that we should be doing all we can to take care of the veterinary technicians. And put out a stern warning.
So in the past, we have had the IVMA put things in the Hoosier Veterinarian that goes to veterinarians, and this may happen before your time here at Purdue or in Indiana. So that's been told to our doctors, our members, not to misrepresent this through just general warnings through the Hoosier Veterinarian, and us sending students or texts from this meeting and saying, go back to IBC and be sure to tell your instructors to teach this. Because when I was teaching part-time at IBC, I did one lecture on the Practice Act and ethics and emphasized that at IBC in Fort Wayne. Never happened probably at IBC in Indianapolis. Fort Wayne's closed, and he's still open. But we've done this in the past. But if you're suggesting as a board, we do a letter similar to Tennessee's, I'm all for it.
Yeah, that's what my suggestion is. And to make sure that it goes out to veterinary technicians as well, so they know that it's out there. We don't get Hoosier Veterinary, so we don't get to see that. Like, I've helped with different task force with the IVMA, but as technicians, and we had to go back to IVMA and tell them that, like, did you guys ever publish our stuff? They're like, oh yeah, we put it out in the Hoosier thing and this and that. I'm like, well, we never got to see it. So like, we don't know what we don't have that. Does that make sense? So if we could put it out, like I get the the board's like updates, like to my email, so like people, like if it went there too, just so that everybody can see it and feel that, like, hey, they're backing me too, and I really appreciate this. I think it would go a long way, and I think it would get shared, and it's a good thing for our board, and would get massively shared that, look, somebody's taking the time to show us that this can happen, and somebody's out there protecting us.
Good idea.
So we have a listserv that we could send something like that out to that would include RBTs and DVMs. I would say that right now, the board does not have statutory authority to issue any kind of civil penalty like this. And I think that Tennessee's fine was based off of a civil penalty. As it currently stands, Title 25, it would be a violation to, under 25-194A13, it would be a violation for a practitioner assisting another person in committing an act that would be grounds for disciplinary sanctions under this chapter, which would basically be the veterinarian allowing this person to act or advertise in a capacity that could be perceived as an RBT, right? And then that would have to go as a complaint to the Attorney General's office and then be prosecuted through the Attorney General's office and have a hearing before the board could issue the discipline, which could be anything from revocation to a fine.
But in many cases, it's not necessarily the assistant or technician that's not a registered veterinary technician that's doing it. It's rather the doctor wanting everyone to think that all of his assistants are actually registered veterinary technicians. So it's as much or more the doctor than probably the
Well, right, that's the
technician.
practitioner.
Maybe I misunderstood what you said.
Yeah, no, the practitioner has assisted another person. So the assistance I see what you're saying, but in and of itself, would have to be just the advertising this person as an RVT or a veterinary nurse or whatever it is, that would be assisting that person in advertising because they're promoting it on
Or
the
they're
website.
assisting like practice manager and out.
So you guys are limited essentially to these 14 items in Title 25 as to what are requirements for discipline, the findings required for discipline. The only other one I could see would maybe be fraud. But I think that you would be hard pressed to get the Attorney General's office to bring a claim of fraud for that. There are a lot of things required in fraud, including damages, which you can't guarantee is actually damaged by putting somebody's picture on a website and saying that they're a veterinary nurse, right?
It damages other veterinary technicians, their job.
Well, I mean, I don't think
Hard to imagine that.
that's not for fraud, though. I mean, you have to actually
So what you're
commit
saying,
a fraud against a person, and I don't think that would fly. So right now, the only way to impose the fine against a veterinarian would be through the disciplinary process, okay? Because we don't have any kind of authority other than for the audits to issue a civil penalty.
So we would be sending a warning or a threat that was reasonably toothless.
Sounds like it would be a reminder.
It would be
That's
more of
what
a
I would-
reminder that, hey, this is a violation of
Whatever it's.
licensing laws because it would essentially violate the Practice Act. Clarence, do you have
That's the one I was
On
thinking
track,
too. I
okay.
just had in my notes, I think you'd have to have a complaint by the AG, found guilty and fine for that to happen. But yeah, you could make the threat that the AG might punish you in the letter.
Again, as I become an old timer, I'm gonna bring up that I think there's still a bunch of veterinarians out there that in their mind, if somebody graduates from a veterinary technician school, than they are an RVT or a veterinary nurse, or whatever. I mean, because when Purdue's technician school started, you know, if you graduated, man, 99.9% pass rate, and I think veterinarians were like, oh, you graduated from Purdue's vet school, that was the only one at the time, then you just assumed they were gonna be licensed, and you didn't necessarily think of it as, oh, you've had the classes, but you are not officially licensed yet. So I think getting the letter out there, anything we can do to remind veterinarians and spell it out. I was trying to look again at the Tennessee's letter, but distinguishing between graduating from a technician school is not the same as having passed
Yeah,
the test. And so I would specifically
I think that's good.
add something in like that, because I think there's just a lot of them that, oh, they graduated, then they are a veterinary technician. And so I don't know that they're all trying to
Because even that,
cover it up.
Say-
Yeah, we
Said
see it plenty,
veterinary
but it's often the few folks coming in for a VT retake, and it's like they're on their website, or like we say, oh, remember that's a title reserved for when you've been credentialed, and that hasn't happened. It's like, we have that conversation. A couple years ago, it felt like every meeting.
Yep, and Paul would always bring up his
Yeah.
class and.
Yeah. I know, because we'd say, did you have an opportunity? He told you.
So I would be in favor of
So do you want to create?
teeth or
a
not.
sample
I think
letter
just as a
for
reminder to
us?
people, I think it would be wise.
So I-
Get the word out again and
You don't
tell the
have to-
IDMA as
You don't
well.
even have to mention a dollar amount fine, just say you will be subject to discipline by
There you
the
go.
board by the veterinary board. Period.
After a few steps.
And Ashley's gonna find you.
All you have to do is say,
You could be subject to
continuing
discipline.
to do this will subject you to disciplinary action taken by the veterinarian.
Yeah, I think that's fair.
Could we even put like minimal this up to, and could even be this, like a fine, or no?
I would-
No, you're
I
right.
wouldn't put any money in it.
Yeah.
You're reaching,
I just figured that's the best way to change.
take the
is to-
victory.
You're the
Okay.
man.
Well,
All right.
I'll come up with a sample.
She'll,
Well, I was
she's
okay
got to
with
create a
fine.
sample letter for us that we can all look at
She
and
said it's
critique.
And you said there's like a distribution list,
off
like a license, I assume.
Everybody that we've given a license to, whether it's
Right
RVTs or,
And then we
Well,
can
what I
tell the
already did.
IDMA about it as well, and they can
Okay,
put it in the.
And be another.
which is better than the IVMA list, because not everybody with a license
Sure.
is on the IVMA.
Good, thank
You-
you.
you
It's
could
always a
say-
good reminder too, because there's a lot of people. Yeah,
You can be reported to the Office of the Indiana Attorney General and subject to discipline by the Board of Veterinary.
Yeah, that includes both of those organizations.
Right.
That's even.
Instead of leaving it up to the IVMA like we did.
And if you use the word could, not you
Yeah.
will
There's a
be,
free-
because
I can check whatever I
don't
want.
necessarily, but
Right.
they may not recognize that could versus will.
A lot of anger. I use AI.
Okay, everybody okay? We're going to move on to Dr. Schnarr. And
Dutch.
the Dutch discussion, anything further, or did we glean enough from our previous visitor?
This came up at the old parts of veterinary get together once a month. And everybody's just working. How in the world, they must have a lot of money because they're advertised all the time. And then listening to the doctor we had in here today, he's offering an opinion and he's only doing licensing, he's licensed, he will be licensed now in Indiana. And he's only dealing with clients in Indiana. It's another one of those, veterinary medicine is changing. I think what we've talked about for the last 2 hours here. I don't know. Do I agree with it totally? I don't know.
I forget, did we ever, I know this like came up a lot during COVID of like how virtual or telehealth fit in. Did we ever end up, like, has any action been taken, or was it still just sort of like everyone's operating within like I couldn't remember when I saw it on the discussion list.
Do you have a chest pain?
See,
No, there's, I mean, there are laws, essentially, Indiana still requires, veterinary client patient relationship
BCR.
in order to prescribe over telehealth. It's
And
complicated, it will require me, to do a lot of research, which I'm willing to do. Eventually, we need to have probably some sort of rule of our own regarding telehealth and televet services. It's just not, it's like third or fourth on the list
Oh, yeah.
versus.
Plus, I just remember
Yeah.
it was like
They're
really
early.
top of mind, obviously, when we were doing everything virtually, because people were kind of like making that work, and it was like, can we do this? But a lot of those people had established relationships. And it begged the question, I think, like you're bringing up.
On the break, Dr. Warenberg, who was here, his assistant, said that she would email me information, contact information for some of the people that he dealt with at Dutch, and maybe we could invite them to give us a presentation or provide some literature on exactly how the program works that maybe isn't on the website for us to.
I'm just bringing it up
Search.
because I was basically told to. So I don't, like I said, veterinary medicine and the scope of practice and the VCPR and all that depends on what day of the week is and what you really feel about it.
Well, theoretically, we're granting Dr. Warrenberg, Aaron,
Yeah,
we're granting him a license. But I didn't really think of this till now. We're also setting him up. Theoretically, he's in violation of our Practice Act if he starts diagnosing and prescribing over the internet without ever seeing the animal, putting hands on the animal.
So there's a
that
question.
is a big issue.
We're
I
almost,
think.
because in Indiana, you still have to have a VCPR in-person examination to start prescribing stuff.
Can you tell me why you think it has to be in person?
Because we said it did.
Where?
That's what the practice act, or what?
IVMA Practice Act Task Force.
I'm guessing you've looked.
When the
There's
practice,
question mark.
but when the Practice Act Task Force that I was on in 2007, that was put in there. And it was reviewed again 10 years later and it's still in there. Because the veterinarians in Indiana want it that way.
So the definition under the Practice Act for veterinary client-patient relationship means between a veterinarian and a client that meets the following conditions. 1, the veterinarian has assumed the responsibility for making clinical judgments regarding the health of the animal and the need for medical treatment, and the client has agreed to follow the veterinarian's instructions. 2, the veterinarian has sufficient knowledge of the animal to initiate a diagnosis of the medical condition of the animal. The veterinarian has recently seen and is personally acquainted with keeping and care of the animal by either the following: an examination of the animal, or B, by recently seeing and being personally acquainted with keeping and care of the representative animal and associated husbandry practices by making medically appropriate and timely visits to the premises where the animal is kept. With what I just said, can you see via telehealth and perform
Yeah, it doesn't say.
an
physical
examination? It doesn't say you have to lay your hands on the animal. And I'm just questioning that because I think that if this were to come to the board or to an appellate court later on, I think that there are probably folks out there that could make the argument that an examination can be done without physically touching an animal.
So 2 things. One, I think the second part there was mainly for the benefit of large animal practitioners who have been to the farm and treated, but they've got a whole herd and now they call up and say, hey, I got another steer out here, breathing heavy, snotty nose, ears down, blah, blah, blah. Can I pick something up rather than have you come out? And because that is always being done. And so I think there was some ambiguity there, I think purposely. The other thing, at the IVMA 3-4 years ago, What's going on tonight, the Thursday night session, the general session for everybody, was a debate about VCPR and whether or not seen means physically touching versus seen on video, and lots of debate. But I mean, that was not to make any decisions. That was to get the veterinarians in Indiana's input. But I guess I'm still under the understanding that in a timely manner, and that's where more of the argument has been. Have I seen them in the last year? Have I seen them in the last 6 months? What is timely? Does it have to be 3 months ago? And then we had this debate during COVID, because it seemed like as a board, it was like, give a little more leeway because people can't come in and can't be seen. And so there was a little more, I guess the state did that as a general rule, right? Not just veterinarians. They opened up a little more.
Yeah, so the telehealth stuff.
Which has expired, right?
Not all of it,
Okay.
I don't think. But what I was looking at is there are, so the telehealth, healthcare services under the telehealth statutes include assessment, diagnosis, evaluation, consultation, treatment, and monitoring. And the term, it also includes if a veterinarian is required to establish a VCPR to perform healthcare services, the veterinarian shall ensure that a proper veterinarian client-patient relationship is established under the Practice Act. However, it's also my understanding that the VCPR really only applies if you're going to prescribe a medication. I think there's probably a hot debate on that question too sometimes, but it does, I know that that's for the federal requirement, and then when you get into some of our prescribing practices, it says you have to have the VCPR in order to prescribe a drug. So it's kind of this combination of all these statutes, coming together
In a mess.
for a variety of things, right? So, yeah, so when you say, I think reasonable minds can disagree on what this says, right? But that's where the big question mark comes in with how the practice of veterinary medicine is moving forward. Is Dutch okay? He said he does the initial assessment. If he thinks that a veterinarian needs to physically touch this animal, he
Did he
refers
say
out.
that he actually prescribed some stuff though? Or not?
I don't know.
Nobody
I
exactly
don't think he
said
said
that.
the word.
But again, in practice, could you not actually see an animal for 12 months or more? And then I call and say, hey, Snooki has whatever, can we get some more of this medication? Or, hey, we're traveling, can you give her some Ativan? Have you recently seen and examined the patient?
We're pretty strict on you.
Well, I actually had that question a couple weeks ago, so that's what came to mind. They took the dog to Arizona and
Website, they have their own pharmacy where they'll ship you stuff.
and there's lots of question marks.
And now I'm going way back, but we've had cases, veterinarians have been disciplined before dispensing antibiotics without seeing an animal. It's happened.
Yeah.
It's happened before, and, the only case example I'm gonna use is dogs vomiting. If he decides to prescribe an anti-vomiting medication, Serenia, without seeing the dog, and the dog has a foreign body obstruction, he hasn't palpated that abdomen, dog winds up rupturing an intestine and dying, he can get sued. That's what concerns me about telehealth. I did it during some of COVID, but I only did it for existing clients that we had a relationship with that I've seen within. the
Every
past
one
year.
of us did it with existing clients,
Mm.
you know?
And
We
we
also
don't,
had
you
that
see
exact
those
case though, where
animals?
the doctor did lay hands on the dog and prescribe.
yeah, it can still
And
happen.
dog
right.
still died.
It doesn't mean the guy palpating the abdomen's any good. But he's
Bell curve.
he's
Just
gonna,
saying.
he's gonna be
Listen,
subject to
it's
this, you know?
Okay, so,
So do we
But-
let him mess up?
But
after the dog dies
to answer your
and
question,
do it,
Brittany,
or-
I know.
Indiana is one of the states that's still considered where you need to see the animal or have had that prior relationship.
Well, I think that's the question
That's
though.
why we've always interpreted it that way. And the Practice Act was worded that way specifically.
But I think you have some people sitting around here that maybe are interpreting it that way, but there's an entire
Possible.
group of over 2,000 veterinarians who maybe aren't.
And
think
so
it's
from a
fair to say.
consumer, you're like, this is wonderful, because I don't have to lug my 95-pound German Shepherd who has a snot nose there. I can FaceTime this vet, and then you can tell me if I actually need to do that or not, until you give me bad advice, and then I will file a consumer complaint.
So this is just discussion. I think it's a good discussion
Yeah,
to
'cause
keep
I-
that question mark on there. And if I could get that information from Dutch and maybe invite them to the April or July meeting to just keep talking about it and see what's going on out there. And I don't know, I think everybody is maybe going to Crossroads this weekend. Maybe there'll be something discussed about it this weekend as well. I don't.
Well, they're,
Same with people though, too.
for this and the leg dentistry, the writing's
Every
kind
time
of
we-
on the wall.
Yeah, we have that
It's
through
really good.
insurance at work, so
For-
you can use telehealth every single time.
We're
You should be
telemedicine.
seen.
For leg dentistry, I mean, the writing's on the wall.
Thanks.
But we still have enough
Literally every single.
conservative practitioners in the state of Indiana that don't want these changes.
Nutrition's office too, they got ear drainage out of
I
it
mean,
too. Like,
A significant percentage.
Yes.
And it's not just the old stuff.
I-
I was just gonna say, mostly 70, but I didn't go there.
Well, I mean, the bottom line is you can get on the internet and get all the Viagra you want by just talking to some doctor.
I'm sorry, I tuned out. for a
I
second.
told you that in confidence, Paul.
All right.
But the commercials are on, I'm using that as an example because you watch network TV, the commercial's on every half hour. You don't need to go to your doctor to get the prescription. You just get online.
Or the,
That's the most.
On that note, I think we should move on. The Purdue Oncology Residency Program.
So I brought this to the board because I had a call from a licensed veterinarian who is up at Purdue for this oncology residency program. It's actually a master's degree program. And she had questions about continuing education moving forward, knowing that this is a renewal year. And she asked if there were any kind of waivers for veterinarians who are in these residency programs, and they're not. She said, I'm up here on a stipend, I don't really have the time or the money to go take 40, hours. Would my coursework count towards my continuing education? And the way it's set up right now, technically, I don't think it is, but I think it should be. And I asked her if she were willing to be kind of a guinea pig for me to bring this before the board, if she would send me her syllabus and some other information. And so that's what I provided to all of you. If you looked at it, there are some courses that are part of the whole program, like statistics, that maybe that wouldn't count, as continuing education because it's statistics and it's not, direct veterinary care. The question that I really have for the board is, would you entertain these courses or these programs? Right now, the board allows for continuing education programs at Purdue to be, there's no credit or approval, or there's no requirement for approval to take the CE at Purdue, right? But not this entire course. And so this will kind of break down a little bit further into additional questions, but with this specific person, would you accept the coursework? And if so, how many continuing education hours per course would you give her, or per semester, I guess, depending on however you guys want to do it. I did some research, and the California Board of Veterinary Medicine for academic coursework, 1 semester unit is 15 credit hours. 1 quarter unit is 10 continuing education hours. And then if they're audited, just the transcript would be sufficient for purposes of an audit to prove that they took the course. I mean, I don't even know, yeah, just the fact that they took the course, because I don't even know if you pass, fail, A, B. I don't know how you would want to maneuver through that. So one question is, which courses would you accept? How many continuing education hours per course? And does this specific person need to fill out an application for approval in this manner, like the corneal presentation? And since it's just 1 person right now, do we need her to do an application for CE approval for these courses? And then moving forward, would it be okay if I worked with Purdue on all of their residency programs just to get those programs approved for, the continued education as part of their residency programs? And then the third question later would be what other schools and what other courses. This will move into rulemaking at some point, but right now we have a veterinarian who has asked. And so I want to be able to give her some information and a path forward. Blanket, are we going to approve this, or do we need her to fill out the paperwork and then it comes before the board in April and it's a discussion like we did today with the corneal?
Well, I think we should approve it. The questions become how many credits does she get for it, that sort of thing. If it's a 6-month course, that makes a difference. If it's a year, if it's 2 years, and we're looking at a 2-year CE cycle, generally to get our CE, it's over 2 years. So a percent of it, yes, I think it needs to be applicable clinical scientific study, not some kind of mathematics type of statistics course or something like that. I think we talked briefly about that sort of thing. So it needs to be applicable type of things. We don't have to turn in an application to get CE. And as long as what the study is appropriate type of applicable type of education, I don't think she should either.
Well, but you do. I mean, the board has to approve continuing education in order for it to count as credit.
If it's automatically counted though, if it's from a vet school,
But it's not,
IBMA,
right, but the statute says
right?
continuing education program. This isn't a continuing education program. This is a graduate level course in veterinary oncology. You see what I'm saying?
I do, but I guess I would
It's a
look at
very
it.
fine nuance.
Could we
But-
view it as technically you are continuing your education?
Well,
Because
yes,
it's postgraduate. I
that's
mean,
why
you've
I
already,
think she should get the credit for it, but we have to kind of develop a different,
Just make it more clear that
Guidelines.
we're accepting it.
yeah, because I think that she should get at least 15 hours per course per semester, because that's a lot of work. I mean, just assuming you go to course or class 1 day a week, that's 16 weeks in a semester. I mean, that's a lot of work.
absolutely.
That doesn't include the fact that she probably goes to class 2 days a week. And, so I want to make sure that we have a path, at least for this one particular vet for this course or this program or however we want to do it. And if it's going to be an application, and then moving forward, I can work with Purdue to give the pre-approval there. That way, they don't have to keep coming in and asking for approval later.
My 2 cents quickly, I don't think, I think this is over and above what we typically are going to get with a magazine article that we are going to answer 6 questions at the end or something like that. And so it absolutely is worth many more hours. I'm all for it. I don't think that they need to submit like we do for the other CE. If it's associated with an approved vet school, we're going to have to dig into weeds more is, okay, then what about a residency program at Indie Vet or
Well, those I think are probably okay because
that's what we
they
need to
are
get through,
approved. Because under Title 25, internships or residency programs conducted in a hospital that has been approved by an organization listed in subdivisions 1 through 7, which if you go back up through 1 through 7, the American Animal Hospital Association often accredits these hospitals that are providing these residency programs. And I know some of them even have residency match programs now akin to medical schools. So
I'm just thinking of the one gal that during the accreditation that we talked
Yeah.
with, and she was
Grand rounds.
grand round, yeah,
It's
was doing
all
that,
over
which,
CE.
yeah, and,
It's not happy
This
with
is-
us.
no, and, but this, to me, this is a little different because these are classes,
these are
there's
academic
lectures,
courses,
there's
yeah.
tests. It's not, I'm just working as a veterinarian and I'm not out on my own yet, I'm
You
working
could be
underneath someone.
asleep at grand rounds.
Yes, so these that have a class associated with them, so I guess when I brought up IndyVet, yeah, that's, maybe I answered myself, that's totally different, because there's not a class with a syllabus like we're getting here. So I think the question then quickly becomes, how many hours per semester? And you had California's,
Yeah, California says 1 semester unit, which I'm guessing is one.
One class per semester, like for
Yeah,
years.
I don't know. I think that she was taking maybe 2 courses per semester. And one of them was like statistics and the other one was more veterinary specific. And that's why I brought that up too, is because it's like, okay, well, do you just want to give her 15 credit hours per semester, period, as long as she's passing her courses? Or do you want to give a certain amount per course? I mean, so there are questions here of how we're gonna approach these programs, which is why I do want to work with these programs and get something a little bit more
We
solidified, so
just
we don't have to.
tacitly approved Warren Burger's 82 hours of CE that he wrote and,
No,
That was
he provided it.
oh, he took CE, okay, I'm
Yeah.
sorry.
Yeah. I have it saved. I just didn't give it to you guys because I didn't want you to read through like 80 some pages and start counting yourselves, because that would be.
Well, did she not also talk about time constraints and money and other issues like that too?
Yes.
Well, time constraints, I mean, per semester, I mean, and I'm going back to our CE is over a 2-year span. And so a semester is like a fourth of that time, fourth of the 2-year time. She's still got,
But she's in a 2-year program.
well, I'm just saying if somebody went for like a semester or they went for a year, they've still got another year. This is not her specifically, but in general. So I don't know, maybe I wouldn't do more than 10 a semester,
Do more than what?
10 credits.
So,
Per course or per semester?
Well, per semester, I guess, because over 2 years, that's her 40 credits and would cover that.
you look at the residency program requirements, different than the actual syllabus and the, the test and whatnot. It has what the requirements, journal review, a minimum of 1 hour every 2 weeks with a mentor present. To me, that's big. I mean, that's, there's learning, there's CE going on there. Minimum of 1 hour every 2 weeks of other didactic rounds with a mentor present. 1 primary author publication submitted by the end of the residency. I mean, there's just a lot in there. So I guess I am more open.
She's getting a lot more than what
Heck, yes.
40 hours is.
So I don't know where the limit is, but I am not opposed.
Sounds like that would cover her 2-year span of CE.
That's,
If it was up to me and you're actively enrolled in a residency program at an AVMA accredited veterinary college, you should be exempt.
That's your
continuing
I second
education
that.
hours.
That's
Just
an
like a new
alternative.
grad.
That's what I would do. If
Well, that's a
you're
lot
act-
easier than
if
trying
you're
to calculate how
actively-
many hours.
If
to
you're
get.
actively enrolled in a AVMA accredited
Yeah.
veterinary college,
Which then helps
And
us
you're
out with the
active-
NB vet
and
part.
you're
'Cause
actively,
That's not it.
you're actively enrolled, then it's an
You said
exception,
NB
just
vet
like you
as
can
an
practice
example of
without a
how that
license.
wouldn't
But if you
qualify.
choose to get a license, you don't have to have CE. You want to pay for the license and you want to have that, so when you're done, you can then go to VCA or Med Vet, you have an active license. Then your CE starts like everybody else.
now,
But while
residency,
you're enrolled,
just
if you're at Purdue and you're there all day long,
You are
come on,
learning.
just give them the credit.
so that's your residency, internship. You're working, you're not, I did not do an internship, so I don't believe you're sitting in classroom.
You're working, that's what an
You're
internship
working,
is.
right?
But you
So
also get treated like the dirt beneath people's feet. So how much time do you have? I vote we let that
I
go
would,
too.
I would.
I guess I just wanna bring it up for
I wouldn't even
discussion
put
so we know.
internship in there. I'd just say.
Well, it's already in the statute, just
Oh,
so you know.
yes. Okay.
Internships
The
are.
word internship?
Yeah. It's not under the Practice Act, it's under Title 25
Okay.
for all professions. And it says, additionally, CE may be obtained from programs designed to directly enhance the practitioner's knowledge and skill in providing services relevant to the practitioner's profession or occupation when offered by an approved organization, including the following. And it goes through a list, including federal, state, and local government agencies, which would allow for like the USDA accreditation to count for CE, or the FDA programs, or DEA programs for CE, stuff like that. But then it says, an internship or a residency program conducted in a hospital that has been approved by an organization listed in subdivisions 1 through 7. And if you go back up,
that's when you got your AHA stuff.
Oh, so that's how they get in, is because they're all accredited? That's how NB vet slips in there?
But to solve this individual's problem,
wait,
Well, yeah, absolutely.
okay.
I don't think you have a problem.
We will move into rulemaking here in a little bit. This is not a rulemaking, but we're not making a rule now. This is for,
This one
I
particular.
know
one
for cleanliness, would
person.
would it still make sense, even though it's a pain for her to submit and request it?
that's what I was wondering.
I just feel like, I
Since
get that
it's
that's
not a
like not
rule-
convenient, because it hasn't been made a rule yet, and because we're just kind of because we would like to move to, you don't need to ask us for this, or you're not getting CE, but right now she still technically needs CE. I feel like from a paper trail and like us being able to then rule make and not have it, like, oh, this was just a one-off where we're just kind of like
So she's
granting.
not already exempt the way.
Which I understand is inconvenient for her. I do understand that. But I do feel like it'd be nice to have that process kind
Well-
of played out to then make a rule and say, after this, it makes a lot of sense to make a rule so that this can be standardized.
Yeah, I mean, she doesn't have to have the CE until October, so it's not,
Oh, so then,
I mean, that's when they have to renew. And I would just,
so we could let her know that yeah.
I mean, technically, I just need her to sign the application for the CE, because she's already provided all of the
I was just saying we have all
Well,
of
let's do
that.
that and just begin with that.
Um,
I'm sure she'd be happy to, she doesn't have to do anything extra than sign.
There, I remember some of the requirements for, under the audit, there were some waivers, but I think that had to do with like being maybe incapacitated because due to like health reasons, or I don't think a graduate program was one of, like, education was one of those. So it would have to do, we would have to include this in continuing education rulemaking at some point. Which is easy to do, once we get to that step, but, okay, so I'll just have her, we'll do the application. You've already looked at it. It can be officially approved at the next meeting, or for the waiver or whatever. I mean, I'll figure it
And
out.
then we'll eventually get into the rules where they don't have to
Mhm.
submit. I think,
Or there's no reason.
yeah.
So
Feel
they're
strongly
like
in that
literally
way.
spending their whole day continuing their.
Yes, like that is so much more than we
Yeah,
have to
like
do.
that's,
But it's
so yeah.
strange, this has never really come up before because most residents and interns at Purdue think they don't need a license. They don't even think about getting it till they're done. And then they don't
Yeah.
need CE for a new license.
So
Right?
good for her.
This is
Good
the
for you.
first. So I don't want to penalize somebody that's
Sure.
being
But
proactive.
she's already a licensed veterinarian?
Yeah.
Okay.
And she wants
And
to
she would
know
have
if
had to
her
have done an
internship or
already.
residency will.
Yeah,
fulfill her
she's
CE.
due
Wasn't it
for renewal in October and would need, I think she graduated in like 23. So she's right, like she just got her license at the last renewal and then she's ready for the renewal.
Good for her.
Mm-hmm.
Give her whatever she wants. I love that initiative. I'm serious. I wouldn't worry about going through course by course
Okay.
and trying to figure out what course.
Yeah, waiver is super
you know.
easy.
Can we make that rule next meeting? Because that does sound super easy.
Well, rulemaking in and of itself is not easy. Um,
Now the truth
So
comes out.
no, but
The
for
waiver
waiver
would
would
be
flip it in later, that'll be
Okay,
easy.
rule no.
So the waiver is easier.
At some point, I think somebody gave us a handout on rulemaking. We gotta get a new picture.
Well, that's where we are now.
Rulemaking,
Not
yay.
today. But Laura's.
Yeah. That's true.
Okay, so at the last meeting, we discussed what our priorities were for rulemaking, and RBT scope of practice and continuing education were the top two. And then one of the questions that I was asked to research was kind of the definition of surgery,
Oh, yeah.
because we didn't really know what that was. We have questions coming in,
That's right.
can my RBT, make incisions and
Cut that.
Like the
cut
gum
downs
flaps
and stuff like that. I will say that in my research, no one really defines surgery in the way that we were asking. So, right, we're not gonna do any rulemaking today. These, this is kind of going, we're gonna go over some, this is a policy discussion about how we're kind of gonna approach rulemaking and go over the outlines and figure out how we want to proceed. So what I did with, oh, where's my internet? To go under discussions and under rulemaking, we'll just go to scope of practice first. My rulemaking outline is, we have a definition of the practice of veterinary medicine, and we need to further define surgical operation and dental operation. I have done research on that. I have a lot of information for you. I'm not presenting it today because it's a lot of information and we don't have time to go over that. What I need from you guys is kind of a direction on how to proceed with this. We can, one way is for me to do the research and then just provide the board with a recommendation through working with our chief of staff at BOA, Dr. Shipman, Sarah Simpson, our general counsel, come up with a recommendation for the board to vote up and down on. You either, love it, you hate it, or you have comments, maybe we should add this, or maybe we should take this away. And then from there, we can start putting it and start doing the actual rulemaking. But what we would need to do is decide if we want to have, if you guys want to split up into committees. So we can either make the recommendation and you guys can vote up and down on it. You guys can split up into committees, go over the research and decide from there if you want to come up with your own definition. That's a lot of work. And we also need to decide if we want to have a special meeting, which could be a 5th meeting per year, or we could have, we could make the October meeting rulemaking only, unless we have like a summary suspension or something like that, and then we would just do the rulemaking up, down. That would give me, well, either way, I think October or maybe September or November, if you want to do a 5th meeting, is when I can have like all the research that would be required for all of the things that we want to do.
I would suggest special meeting.
I vote yes.
I would agree with that too,
On a-
mainly because.
On a 5th meeting,
Yeah,
or?
we're
Okay.
full on every
Yeah.
meeting as it is. To eliminate one of those meetings and make it entirely for ruling, that would make everything else super packed. I
Dr.
would think.
Shipman told me his first year here, he wants to see us as much as possible.
I think he was just talking to you.
More
You're a delight.
So we have a meeting scheduled at the end of October. Would you like to have that 5th meeting in September, November, December?
Whenever it's not the fair.
Well, we're having that July meeting anyway.
Well, yeah. Fairs is
And our July meeting, I think, is
unless you have it really
Usually
late.
slower.
proposed for
Later
the
in
July
the
31st.
September's,
September would be more better.
In
Really?
November.
not for me. That's a busier time. I mean,
October?
much more going on.
Well, October, we already.
We have
what
an
about
end of
November?
October, so we'd be talking about,
We could also, if everybody's up here, Gary, correct me if I'm wrong, but if our October meeting were to be October 30th, our special meeting could be October 31st.
Oh, if people.
If people wanted to stay up here, or, we could do that. We could have 2 days of meetings where on day 2, we would only do the rulemaking. But you have FFA.
Yes.
That's gonna,
So it does.
and so does the state vet.
Yeah, October's pretty busy with USAHA.
Superintendent of the committee she serves on.
Aye.
So when is Dr. Shipman free? No. Never.
We
Just
can do the
throw
week
a
before
date out
that.
and I'll tell you whether I'm good or not.
Oh, wait, we moved that already, didn't we?
23rd.
23rd is what we're, yeah.
Thursday, October
Officially moved.
23rd.
Did we move it to the 23rd?
Mm-hmm. Because
I
of
thought you were
that,
just giving
we
an
talked about
example of
that.
dates, so I didn't.
Yeah, so then 23rd and 24th would be
She's gonna do a double header.
promotion
Can
if
you
that's
guys
what
be
you
out
want
for
to
2
do.
days?
I mean, that's an option. You guys can do whatever you want.
Ideal,
Or
but
do we need to go to like a whole nother month and just do it?
You want to do another?
I'm in town, so it's more for like, you guys have to
And,
travel.
and it
Do you
doesn't have to
wanna-
be the end of the month either, if you wanted to come back the first weekend, or the second week of November or something like that, we could do that. But we do get into the holidays, and with just people traveling, that could be,
What are our virtual rules again? Is that,
I would not recommend it, well,
that rulemaking happen virtually?
not with you guys, now, it would have to be.
Wow.
Not with you guys, but just
Show you
as
I'm not
a,
capable of that.
as a board, I
Most
think,
people are computer literate.
Well, and the one person talks, then that takes off
So
everybody
no.
else.
yeah, that's what I was gonna say, is I don't think any board should do rulemaking electronically, just because you talk over people, and it's just, and we're gonna pass around papers and make notes and just different things, and I think, now, it will still be recorded, and people can be present via Teams, but,
And there wouldn't be any public participation at this.
right, right.
That meeting would be to develop a proposed rule that then could be taken to the IVMA and everybody else for comments.
I would personally would prefer a separate meeting date, not back-to-back, but
Okay.
that's just
I would-
me.
I know.
I
it
didn't
doesn't
want
matter me.
to push, but I would say that's probably better for myself and my clinic as well.
And the children.
So maybe, I don't know, a few weeks after the one we're having or something.
Work from home
It's-
now,
It's
2 days.
before Thanksgiving, it's in
Person?
November,
Week of the
it's a boring month, everything's turning brown.
Week of what?
Week of the 10th?
Do it early enough, then
November?
you don't have
Yeah.
Is
holidays.
that working for you? I'm assuming if you're going to bring that
The
up.
week of Veterans Day is on Tuesday, but that week is a few weeks
That
later.
Thursday.
Well, you can.
It doesn't have to be Thursday either. I mean, well, it can't, if it's that week, it probably can't be Monday. And then, right, because you said it's
Tuesday's
better.
better.
Tuesday
Or
is
Tuesday's Veterans Day,
So just
okay.
maybe Tuesday.
But is there election day that's gonna fall in there
It's
too?
the
It's
week
the first
before.
Tuesday.
Okay, good.
How about November 13th, Thursday?
We are looking at,
Second week in
Get
November.
our work
yeah,
fast.
we're looking at.
The regular board meetings, the 23rd of October.
Yes.
I said I can make that.
Work for me.
Thursday.
Which day?
November 13th?
So then that's a Tuesday?
Thursday.
Thursday, another Thursday.
Mhm.
So 3 weeks later.
Does that work for you?
So that'll be the rulemaking.
Would you send all these dates out? Like, not just this new one, but all the dates we have.
I think I
Probably
did.
that.
Look at the bottom of your
Yeah.
agenda, you got them all. on the bottom of your
It's
agenda.
always at the bottom of the agenda, but I did send out an email too, and I can send it out again, and add that 5th meeting in there for November 13th, if that's.
By golly, there it is.
Oh, yeah, we ought to have it during the state fair, and then we could get some food delivered.
Some lemon shakeups.
We will be so efficient.
Well, last couple of years, we've gotten free tickets this year.
Well,
Yeah.
All right, what's next?
Stay with her and set us up,
Okay.
didn't they?
See if we can get.
Kyle,
Well, so I have, on my scope of RBT outline, just the definitions, surgical operation and dental operation, and then definition of complementary medicine. I think right now, Indiana doesn't define that. I've had some calls. I had one particular lady get pretty upset with me because I was telling her that the osteopathic online program she was taking that was based out of Scotland was probably going to be considered practice of veterinary medicine if she was manipulating, horses. And she didn't like that answer, but it's not defined, complementary medicine is not defined in the Practice Act. So I would suggest making a definition for that, and I have done some research on that. If you look at the sample that I provided, the recommendation that I provided,
Is that at the bottom of this?
no, it's a different page. Still in rulemaking. It just says rulemaking directors, research and recommendation. This will kind of give you an idea if we're going to go the recommendation route.
So that's a different page from the RVT scope of practice.
It's a PDF.
Oh, I got it.
Yeah.
Okay.
Yeah, so you'll see this is kind of the way that I'm going to approach all of these.
So was that from Yeah, the AA, I read that, from the AASB, B is the one definition, VSB.
So Indiana doesn't define, and then I have the VSB Practice Act model, and then I also have the AVMA Practice Act model definition. And then in B, I have a recommendation on which the board would vote up or down or add commentary. And that's how, this is my idea on how to move forward with all of this, unless you guys wanna form committees and do it yourself.
I like you researching, putting things together and then saying
We're
what
like,
you guys
"Yay."
think.
Spoon feeding.
I also don't want to overwhelm you, so please
It's okay,
let us know.
So the
We're
AVMA
learning too
and
much
the
on it.
AAVSB definitions are pretty close.
they're almost identical.
Yeah.
Oh,
Oklahoma,
I
way
mean,
too complicated.
I don't think there's anything wrong with the AAVSB
That's all I'm getting.
You
model
wanna lead one of those committees?
definition.
Um,
I'm having trouble finding,
It's in rulemaking.
that's where I'm at.
so then the other items for RVT scope of practice would be levels of supervision. Indiana currently has direct supervision and indirect supervision. Based on my research, I have some ideas of maybe adding a couple of things to those. For instance, direct supervision says that a supervisor has to, monitor the assistant, but there's no definition of what a supervisor is. It doesn't even necessarily say a veterinarian. Now, with indirect, it requires a supervising veterinarian, but who is that? I mean, is that the owner of the practice? Are there other associate veterinarians who are working in there because any veterinarian can provide indirect, supervision. So I just think tweaking those a little bit. And then I would also, once you guys see the definitions, I'm gonna recommend that we adopt some form of immediate supervision. And that has a definition of where essentially the veterinarian has to be within eyesight of the animal.
For the premises?
The immediate supervision,
Yeah.
they have to have eyesight on the animal while the RVT.
Oh, I thought that was direct.
No, direct is just on the premises.
Oh, I got switched.
Direct means I have to be in the building, and then you can do your thing.
And then it goes
Not
Indirect.
very
And
direct.
so indirect is.
Indirect means I can be in the car on the way to the
Or
clinic.
email, it says like electronic, yeah.
Yeah, that's
Immediate means I have to look over your shoulder and say, you're not doing that right.
Go,
Yeah,
I think when you get to the allowable animal health care task, if you were to adopt that, part of the reason that the immediate supervision is in there is so that the questions that we're getting is for the RVTs to do some of these cut downs, like they can be doing one thing while the veterinarian's doing another, and they're working on the animal together, and the vet has eyes on the animal while the RVT's assisting.
so do you have to answer that one email that you got? There's no obligation to respond to that.
No, I mean, the board can't provide legal advice, and especially the disciplinary board should not be providing advice. Most of the time when I get these questions, I'm sorry, the board can't provide advice. However, here's what the Practice Act requires for the definition of direct supervision. And I just provide the statute. So,
Yeah, there's no laundry list, never has been.
and then, so then the final
Making
question,
rules for a while.
I mean, the final question for you guys is, do we want a list of allowable and prohibited healthcare tasks?
I think the technicians would like,
the the reason
I
it's
think
not in there,
most veterinarians
but then you get a
in the
laundry
southern part of
list,
the state and
and
the hills don't want it.
as practice changes and
Because
it's
it's not
not
easy to get
listed.
an RVT, right?
Well, let me show you, not today, but let me show you the research, because the AAVSB has some pretty specific enumerated, this is what a vet tech can do under immediate supervision. This is what a vet tech can do under indirect supervision and then direct supervision. It's
So we're
pretty,
not having to reinvent the wheel.
no.
I feel like we had
You can add
questions like that in vet school. I feel like when we were learning all that, we had questions like that. Like, what kind of supervision is this? So it doesn't have to be all-inclusive, but to have somebody,
No, it doesn't have to
a
be
general idea.
all-inclusive, but when you're getting the really big questions of can they do this percutaneous and, you know. Yes, they can do it under immediate supervision, right? At least that helps the veterinarians. I mean, frankly,
Helps everybody.
but I had so many veterinarians call me now and say, hey, can my RVT do this? Or even, can my veterinarian who graduated and failed the NAVLE and is retaking it again in the fall, can they treat patients and do surgery by themselves?
They actually call you to ask you that.
Yes. More than one.
You could say, sure, they can, but they shouldn't.
Well, that would be practicing without a
Yeah.
license.
Exactly.
So I mean, there are a lot of question marks on
So that they're interested.
active veterinarians and RVTs now. They don't, and just from some of the cases that I've brought before the board, the vets don't know what RVTs are allowed to do.
Yeah,
That's
I
a
think
big
that makes sense. Within reason.
Traditionally, the reason why
Yeah.
is with the shortage of registered veterinary technicians graduating from an accredited school, there weren't enough of them. And there were a lot of on-the-job trained assistants that were more than capable of doing much of the same thing. And so there was pushback from most veterinarians in my generation and older to say, we can't do a laundry list. We've got 6 young ladies in our practice, only one of them's an RVT. And Ethel has been doing stuff around here since 1958. And she's really good. I'm not.
And Ethel will keep doing it under direct supervision.
Right.
That's,
But that's
So is that
why,
full of
Hey,
RVT?
and
but I'm
No.
telling you, that's why it was left
you
vague.
can do it under direct
our
supervision.
program great, 38% last year. We usually try to struggle for 10%, and we
Saying Ethel
38%.
can do whatever she wants under direct supervision.
But when we won that practice
People can
act
shave
task
the
force
teeth.
in 2007.
Yeah.
Yeah.
Yeah, but there's no one to do the direct supervision. That's the problem.
Well, but that's what I'm saying is if
Ethel can volunteer to do
I
it,
can
but
just have learned on the job under direct supervision and I just need some teeth shaved, I don't care.
Or you could be
You
like
spend
my
$60,000 on your horse, that's your problem.
you'd be like
They mess it up, that's a
technician I
very
had.
expensive mistake you made.
I would be back there trying to read the daggone newspaper and she'd yell at me from surgery, "You'll get your ass in here and spay this cat."
Ethel's got a
Is this
bad
on
mouth.
tape?
Yeah.
Yes.
Oh, it is.
Oh, yeah.
Okay,
We're green light.
I don't give a rip.
Too much.
moving to continuing education, rulemaking. My outline for that, it's a lot smaller. There are 4 things that I think that we need to discuss throughout this process. Content, which we kind of talked about that with the residency program. But one thing that I've gotten emails asking about, so there are veterinarians who only do research, but she's still a licensed veterinarian. She's going to this big conference and it's like, I don't even understand the stuff that they're talking about because it's all research, it's all statistics, so I don't know, maybe there's a carve out for that somewhere. And then practice management and wellness. Do you want to require practice management and wellness programs. Do you want to limit wellness programs to 2 hours per renewal period? Or do you want to require 2 hours per renewal? You know, we've got some substance abuse going on and there's a reason for it. And I don't know. Is it because their practice is overwhelming? Other jurisdictions are adopting rules like this.
Oh, like veterinary?
So, and then, so source is also, which sponsor or course is approved, and that's the residency program too. Delivery method is the big one that we need a rule on, and this is gonna be my primary focus, moving forward, because we need to know in-person, interactive, on demand with no test, no interaction. I have some basic information from a previous question that came out to the AAVSB, and out of the 21 states that responded, there were at least 6 that had 0 delivery method requirement. So everything could be online. They did not require interactive component. They didn't require a test or a quiz. Nothing. And then there was a mix in between what we currently have, which isn't working. I get at least 3 emails or phone calls every single day. Does this count as self-study? Well, self-study is reading a magazine and taking a quiz. It's not an online program. And we have no, does this webinar, you know, it has, you know, it's a webinar, but it's a live webinar. Does this count as in-person? And I was like, we don't have an in-person requirement. I don't, that came somewhere. I don't know where it came from. In-person has been removed from the website because that is not a statutory or rule requirement. And I think Laura even mentioned that back in July or April. I've gone through and watched several of the old meetings. So just moving forward, these are things that we're going to have to look into. And then another question is, are we going to continue requiring 40 hours for vets and 20 hours for RVTs? Some states only require 20 hours or 16 hours for veterinarians.
Was that decision though made at the statute level?
What?
Those hours were in there before we even redid the Practice Act. I don't know, those things came into play in the, I want to say mid-80s is when continuing education was first.
It's in the rules.
But I mean, it's been a long time. I mean, I don't think the number of hours has ever been changed since they originally
Since I started.
required CE.
And they don't have to change, but if you don't, I'll give you some research on what other states require, just if you know, one of the things that the new administration in Indiana is looking at is, you know, decreasing barriers to licensure, and that would probably include continuing education. And if Michigan and Illinois and Kentucky and Ohio are only requiring 20 for DMVs, then maybe that's something that, after me doing some research or presenting, that maybe should be considered. Just saying. Don't have to do it. It's just throwing it out there that's.
It seems to me like when I graduated in '82, it was only a few years before I had to start doing CE. I want to think that CE requirement was put in the late '80s.
I think it would be interesting to see what all the, or at least
And
neighboring
it's
states.
been the same
or
number of hours
Western
since then.
states are doing.
I'm pretty sure Michigan requires less, because I had somebody reply who wanted to renew her Indiana. She had been expired for a little bit and had only been licensed in like Michigan or Illinois. And she's like, well, I'm only required to do 20, so I don't have the 40. But she's also licensed in another state, and under the reciprocity statute now, she doesn't even have to have, I mean, she could just apply, like reapply under reciprocity and be licensed regardless of how many CE she had. So, I mean, it's
I
a
don't know
mess.
that 40 hours is keeping anybody from re-upping their license, but one might lean more heavily towards allowing unlimited or a pretty large amount of online.
Mhm.
And then that takes away surgery, and I've been out for a long time and I don't have the money, and because a lot of those you could do easily that way.
I came across that specialty technicians like BTSs were having a hard time with certain states requiring in-person, or they couldn't go to like those bigger conferences that had like their specialty in them. So they were wanting more online options so that they were able to do the CE that's required in their specialty too, because they have to get like 40 hours in their specialty. So that was a big question that came up in mine.
Okay. And the only other thing I have on here is the same rulemaking director's research and recommendation, just to show you what research, these are just 2 samples of the, or actually 4 samples of the different CE requirements that are out there, out of the 21 that responded on that. 10 out of 30 have to can be pre-programmed, meaning, the on-demand without, that's what West Washington's doing. Virginia, no requirement.
They have CE, but it doesn't matter how you get it.
Yeah, the delivery, there's no requirement on the delivery method. So yeah, that question was just delivery method. I don't have a recommendation on this one yet, just because it's,
Oklahoma looks exhausting.
yeah, and that's,
I guess Team Interactive feels more important.
but that's more, so 2 hours of mandatory review of the
I
Veterinary
said
Practice
conference
Act.
room and, like,
That's mandatory.
Like I can get an email on my phone all day there.
How do you find a CE
somebody has to
program for
rank
that
those
every
ones,
year?
too.
They must have their own program.
Well, yeah, I mean-
They probably have to do a jurisprudence exam or something every year, watch a video or something. Yeah. So,
Doesn't Indiana, you don't have every renewal period, we're supposed to have 2 hours of
opioid,
opioid.
That's
to
still,
be determined.
is that still in effect
What an
Well, I think so.
for this next renewal, the 2
To be
hour?
determined.
Yeah.
We don't know.
We don't know.
I think
Yeah.
that rule expired.
Rule expires.
Oh, okay.
Don't you think most veterinarians have got the message by now?
Then
I
why
would
do they
think
keep
so.
coming here?
Huh? As far as the opioid thing.
Yeah.
I mean, you gotta keep coming up with just a slightly different slant on the same thing. Lock up your drugs. Don't take tramadol.
Well, that's a requirement for all CSR holders, not just the veterinarians, so.
But it expires, you said.
Currently, I don't know if there's a bill to renew it yet that
I
I've
mean, I
seen.
know the opioid crisis isn't over, but as far as trying to find a new one,
Sure.
not repeat what you already,
Right, there's a challenge there.
it's gonna start becoming more of a challenge. I mean, Lisa's gonna do it because it's a moneymaker for the IVMA.
Sure.
I might be wrong, but I don't think there's any opioid classes at this meeting the
No,
next
no.
2 days, because she does them separately and they're $60 a pop.
There are
I'm
free ones
serious.
out,
No, I know.
there are free ones out there. Because I've looked them up for people who have called, asking, they're trying to get a license in
There's a bunch of
Indiana.
free ones online.
Yeah. The DEA, I think, has
Yeah.
some, the AVMA has them, so. And they're
Municipal
cheaper.
conference, that conference generally has
Yeah.
some there.
But
for
I
their
think,
purposes.
I think IVMA found out, well, we can supplement our income a little bit here. I don't know how much it was, but substantial enough for her to keep wanting to do it. I'm assuming she's gonna do it this year.
I would assume so too, but I don't know.
Is there more?
That's all I have on rulemaking, and I think that ends the discussion. I can move into my report.
We did have
There was BT.
proposed, BT&A and
Oh,
NAB
that's right, we moved them
retakes
up.
and proposed settlement agreements. Quickly, for VTNEs that are on the 4th try, like the 3 that were here today, the question came up, do we feel they need to appear? Or can they be taken care of over the phone, potentially by our director? My comment to her was, if we want this to appear to be a serious issue and to discuss with them the importance that this is their fourth time and it's not an inexpensive venture, and maybe be able to have some inspiration to do a better job and maybe some advice on how to accomplish that, it may just make it seem less cavalier and more important to bring them in. I don't know the percent of 3-time failures that then after coming in make it on their fourth or not, but if we can make a difference in them being able to pass, I think that it went pretty quickly. I mean, we didn't spend a lot of time with those 3, and I need to hear whether y'all think there's benefit to that or not.
I think they ought to come in for the reason you just.
I'm strongly opposed to them appearing in person. I think it is a massive expense for them and their time, and we have never told anyone no. I think if the board director could handle it through a phone conversation, at least confirming that you've done these things, are you progressing? But I also think it's a monetary expense for them and time and energy to take the exam again, and we shouldn't stand in their way if they want to. So, sorry, I feel very passionately about this because we've had people drive up from Evansville to talk to us for 3 minutes for us to say, yes, you can spend more money to take this exam again. And like, they're taking half days off work, like some of them have kids, they're having to arrange special childcare. And if we were like deliberating each time, but I can't think of a time when we've ever told somebody they can't.
Well, and we had the conversation to support what you're saying, even
So sorry,
though
this
I
is
like.
something I felt passionate about for a while that you asked, so I.
Yeah, no, Paul and I had talked, that who are we to stand in somebody's way to take the test again? It's their life's ambition for us to say, no, you can't take it. So they're all coming in knowing that we're gonna say yes. The question just becomes, is there value to that or not? And I certainly hear everything you're saying.
I don't know that they're all coming in knowing we're gonna say yes. I haven't asked,
nervous.
some of them act very nervous, so I don't know.
Well, they're all
But
coming in, us knowing that we're gonna
Us
say
knowing,
yes.
know the difference, and
Well,
if
probably
we know,
embarrassed that they have to say. I
if we
failed
know,
this.
then even more so, I would lean towards Natalie's thing, that is an expense for them to get here and the drive here, the time away from their assistant job or whatever it is they're doing currently, more stress of what's gonna happen and seeing all of us up here. But to your point of, if there's a way we can give them some advice and help and see how they're studying, maybe it becomes when they apply for that, they let you know, maybe there's a questionnaire. What have you done to study so far? We need to see your scores. So what they're already submitting, but maybe there's what have you been doing, so that gets them thinking, because that's what we're asking them here. That's what we tend to go over is, how are you studying? Do you have test anxiety? Have you asked for special exemptions for your test anxiety? Can that be done through you, just with a form or something, just as well?
Okay.
You feel like you have
But
time
the
to do
free,
that?
the
'Cause I think you need more of a phone call.
I think we've
frequent,
had only maybe,
A lot of
A
times
couple.
I'll get in the email, hey, I need to request, to take the exam. I've been doing this, I've been doing that. And now the only thing that I don't get really in the email is a lot of the work experience. So, I'm picking up more shifts in the ER to get more experience there and get that score up. That doesn't mean that they're not doing it. I just, that's not volunteered information. So I don't know.
Could there just be a form?
Standard
Yes, so you
question.
don't have to be emailing back and forth all the time, say,
Mhm.
fill this out. And then those questions,
Yeah, we can create a form like we did with the jurisprudence exams and the other licensing.
How regularly do we share information? Like, are there, like, the VT&E is, I think, what we see the most. Like, we haven't seen that many on the NAFLE, which is the other one, right? But like, is it like a best practices or like any, like, does the association have like any information? Like, are we allowed to provide that?
They only
Taking
provide
it.
the first-time test taker scores to state boards and to institutions like AVMA accredited where they go. They don't have I've called, I'm like, I want to know how many like people who didn't go to school passed the VT&E in those states, and they're like, we're not going to track that.
And it's going to be
Well, they
harder to
track-
track too.
The schools track their graduation rate and their pass rate.
Yeah, we have to have it has to be on
That
their website.
that's
a
based
3-year
on their
rolling average.
accreditation too. If they,
If you look at the placemat that I just gave, this is still in kind of draft form, but will be presented, we'll have it at Crossroads. If you look at the bottom, on the exams for the VT&E for 2024, 193 people took it and only 49% passed. Now,
People or times, like,
I don't,
do you know that?
okay,
That
yes.
number?
Well, they're mixed
Okay.
because
Yeah.
it would just be
Be difficult.
confusing. Some of these were retakes, but I don't know how many times that person has retaken the exam. Now, these are also only the people who put Indiana as their jurisdiction. They don't have to put Indiana on their jurisdiction anymore. Or they don't have to put a jurisdiction at all moving forward. And the same thing, I think, with the NAVLE, there will be an option for that. So this data is sort of reliable. I mean, it's reliable for the people who have put Indiana as a jurisdiction. It doesn't necessarily mean this is how many people have taken the exam and then came here to practice. I mean, even quickly, somebody might take the exam in Ohio because they live on the line and then they get a job in Indiana.
But I want to go back to what everybody was talking about. I see both points, and I think it's super important for them to come before us, just because I was one of those 4-time people, and I don't see a lot of 5-time people in here, if you think about it.
But
had
do
a
they give
couple.
up?
Well, there's a couple, but there's not the same amount we see as the 4th time, so I think that.
Unless they give up after, they may have hit their limit,
What?
right?
They may have hit their limit.
They may have hit their limit, like, I'm not doing it again, I've already.
Oh, for sure.
So, I mean,
Yeah,
did they pass or did they
We don't
fail and just say?
but I don't know, it was
okay.
super important to me to, that importance of, I went before the Tennessee board. So when I went in front of the Tennessee board, I was like, oh my gosh, you're gonna tell me no? But so I thought those things, so, I passed on my 4th
Well,
time.
if you fail on your second one, you're like, no big deal, I can take it a third time. I mean, if you fail on your third one, it's, oh my
It's
goodness, I've got to
devastating.
go before the board and blah, blah, blah. And
It's-
I really would love to know what % of 4th takers actually pass it, Is coming before us making any kind of difference, or are they just, it's magical 4th time that they all get it? And I don't know that I would think that just because it's the 4th time they give up. I mean, 3 strikes and you're out, why not give up after the 3rd?
In some
one?
states, they can only take it 5 times, and if past the 5th, then they have to go back to school. I've heard that in some states.
Can we do a Zoom call with them instead of personal, or make Brittany do it? So they'd stay there, but they're still talking to us and feeling some pressure?
Well, I mean,
I think
if as
Steve's
a
okay.
representative of the board, she wants to, or we decide to have her stress all of the important things we've talked about, that likely may be okay, whether it's she Zooms it or whether she just talks with them on the phone or whatever she wants to do. I just had always felt that maybe there was a degree of importance of us actually having them here talking to them. Now, I didn't consider the imposition on them because we drag everybody else in here. I mean, it just didn't cross my mind, and that's a very fair point.
statute states that the board's supposed to approve the applicants, at least put their name on the agenda, even if you don't make them come.
Well, but the board has to approve applications all the time, and it doesn't have to come to the board. There doesn't have to be a hearing. I have authority.
Yeah,
the
because I guess
form-
if they don't have to appear in person, then can you just like approve them as they come in and they have their answer?
I mean, I do that sometimes, and then if I have a question, I consult with Dr. Rodenbarger as the chair, and I mean, that's why the Julia Yeager was taken off, because that was resolved through a discussion with Dr. Rodenbarger instead of the whole board. It happens. So I could do, the fourth time, for the fourth
Yeah,
time, I can do it.
I'll
and
back
then
off
fifth
on my
time-
stance only because I feel guilty after being spanked about how challenging it is for them and the expense and time spent and all that. I was just focusing more on what I thought we might be doing to help
Yeah,
them.
I just feel differently about them specifically because if people are involved with us for a disciplinary reason, I don't have as much sympathy for the fact that, you were fully in control of your circumstances that led to this. Somebody not being a great test taker or having, like so many, like even I think 2 of the 3 today, well, I had a kid in between this time and then I'm dealing with childcare and this and that. And it's like, it's not their fault,
Nope.
that
Fair
it's a
enough.
study thing, but it's not a disciplinary thing. So that's, I feel strongly about us considering at least how much we are asking of them when I can't think of a time we've said no. If we spend a lot of time deliberating on them, I also would probably feel different, but I think as long as everyone shows that like they are taking steps to want to pass the exam, like we
I would like
haven't stood in their way.
The phone experience to be as much like what we're trying to provide with inspiration to them as possible.
Yeah, because I think it's been helpful, so specifically, I know on like the testing accommodations questions, that comes up all the time, and a lot of folks have said, I did not know that, or I didn't realize I could ask for that. So I think there's beneficial information we provide, but yeah,
Yes.
maybe there is a way we can either like standardize that or just,
Well, that's what I think Steve's idea,
Yeah,
if
with
there
the
is a form. And if we could include something
just
in
like a
there,
draft of each question for them.
Okay,
just a
so,
statement to say, be aware that if you have test anxiety, you can request accommodations. We're not really giving advice specifically, but we're just,
Yeah.
it's no different than us telling them in person. That one sentence could be added, because that's really the only value I've ever seen, is we have had a few that we've said, hey, did you know you can request accommodations to ease your test anxiety and give you a better shot passing it this next time around? And I think we've had maybe 2 that said they didn't know it till we told them. The rest already, most of them know it.
so I'll come up with a form for the next meeting that you guys can approve. And
Form feels really formal, maybe even just kind of like a list of questions. Yeah, just like.
Well, no, when I say form, I mean like an electronic form, because honestly, that makes my life easier.
Okay, then
If they
yes.
do the form and just click it, and then I can, instead of just being sent emails all
Then
the time.
you can ask it, what are your scores, the dates and the scores?
Yeah, that,
Part of the.
Where did you go to school? What are you
That's
doing
me.
right now?
So Brittany gets a question, right, for the 4th attempt. Is the thought then, just so I can do the process, right? She initiates a form to them, they submit the form, she reviews the form, she meets with them virtually to review the form together. And then a decision's not necessarily made that day, but she'll take it back to the board or whatever that may be. to
I don't
then
think we
deliver
should
the
take it back
decision.
to the board.
No, I would
Okay,
give
or
Brittany
just give-
full
Eliminate
discretion
that.
to decide if you
Okay.
need to have the phone
Sure.
call or.
I was gonna say, yeah, I don't even know if there has
Or
to be
if you
a
read
phone
that
call
and
these
you're like,
days.
this is what we hear from everyone. great.
and 5th time or 6th time, do you want the board to do a personal appearance at 5 or 6?
Yeah, there's a problem.
Because the statute requires,
I've never seen 6, we have seen a couple 5s.
the board requires board approval, right? And
Right.
I know what Clarence is getting at. Through the board, delegation to Dr. Shipman, who has delegated it to me, I have authority to act on behalf of the board to do this, just like I do with approving licenses multiple times a day, right? and renewing licenses, because we have all of these parameters in place to do that. And I think that's kind of what we're getting at with the form and the questionnaire. We'll do that, but and then I can approve it. If I have a question, I can run it by Dr. Rodenbarger, like I do the applications, but only if I have like a real question. Like, usually I run them by him, because like the last one was a bird who died as a result of some anesthesia question, and that's way above my head, right? There's no requirement under statute that they have personal appearance, just that there's board approval. So
I would say they're so few and far between at this point. I'd be comfortable with your discretion, but if you say 5 and you want to reach out to Dr. Rodenberg and be like, do you think that this one warrants, because
a personal appearance.
yeah, like they just continue to take it and they're not making it,
They're not
whatever.
ready to close.
Yeah, I just feel like that doesn't come up very often, so like, hopefully we can just use our discretion, and then if it seems warranted, we can discuss it at time.
Well, like usual,
I'll compromise after 4.
I'll go, what would Natalie say?
Natalie doesn't like to
Don't
get
bring 'em
people's
in.
way of bettering
He's now the
themselves.
bikini liaison.
It's not cheap to take it.
Well, that's what I'm saying, it's not cheap,
Check
and
it
No,
like,
it's not.
Or to do the study materials.
Or to do that.
Well,
Okay.
One thing you
Carl?
can tell yourself too is,
That's true.
when we had an explosion of this, when there were 2 ground
I was
Mackies.
joking, but yeah.
No, but I'm.
2 of the, what's the school that was in Indianapolis
Natalie,
that Bryce Finney ran?
Yeah.
Harrison.
Harrison. You had 2 brown Mackies, 2 Harrisons, maybe another brown Mackie up in your neck of the woods. 2 IVCs. You had 8 schools in the state. You went from 1 to 8 in about 3 years. And we had a slew of students going through the brown Mackies and the Harrisons. Those were the ones that were rolling in. I mean, we get a Purdue one once every 3 years. And now that you're down to just 2 programs, the IVC in Indy and the Purdue program, they're all from IVC in Indy.
We're in like a 99th percentile mass rate.
Right.
Like
Purdue's,
7%.
yes, I've noticed the similarities on
I
where.
was on the AVMA
If
accreditation.
Purdue
Alright,
had
I'd
one
be
that
sending the
didn't
bill for the
pass,
4th exam to my school.
if Purdue had one that didn't pass, Pete Bill had to go to the ER.
And they
I mean,
passed
it's
on
the
the
way it-
second time.
But now we're down to just the 2 programs. We're not seeing what we saw 10 years,
Yeah.
10 years ago. There was an explosion. There was about a, 3 or 4 year period there. We were just hammering with those. Not as bad now. And there's no doubt that the sense of relief on the 3rd person versus the 1st person was huge. The 3rd person realized, oh, they're gonna let me do this.
It
The
was,
1st person was
You can't prepare. for
crying tears of joy that we okayed
it was
it.
also explained to me once, many, many years ago, because I've been thinking about this in like the 9 years I've been on the board, that this was initially put in place to prevent like professional test takers from coming in and stealing answers. And I imagine that also happened when like you physically went in and had like a paper test and things probably didn't change, but now there's like security in place and questions change and formats change, like.
Takes their picture now.
Yes,
Yeah.
so like it was explained to me that was the original intent behind it, was that so there wasn't someone who was just like taking it once every time it was out and like selling the answers to folks, but it seems like they have pretty good security on all of these examinations now, that like their system would also flag that.
We did have one that she had all the answers to the wrong test or something not too long
Yeah.
ago. That was,
That was the
Well, that was the
jurisprudence.
jurisprudence.
oh, that was just,
Yeah.
that's one, okay. I was like, oh.
Yeah.
How many times did they get to try to take that one? That many?
Well,
Indefinite.
she tried to take her
I'm
friend's
like, right away.
test,
Well, that doesn't work either.
and the answers to her friend's
So
test
that's
were
it.
different than the answers to
Because like
her.
after my 3rd board meeting, I was like, why do we keep seeing these people? And we always tell them yes. And then one of the very old board directors was like, well, this is why I originally started. And I was like, now they take, yeah, you said they take your picture. So if you're 17 times in, they know who you are.
So are we all good? We're on
Yep.
same
So,
page on that?
minutes.
The last thing under that area was the proposed settlement agreements. The discussion that the 2 of us had was instead of having them come in for a hearing, instead have them, well, they don't appear anyway, but for us to put it under discussion or some other area.
It would just be probably its own area, but it would just be a vote up or down. If you had questions, if there were too many questions on it, which most of them go before a settlement conference anyway. So there are a lot of questions, but if you have true questions about the care that was provided that can't, that isn't in that agreement, then you deny it, you set them for a hearing. This is how the nursing board does it. It would reduce a lot of time during the day. I mean, we could have probably saved 40 minutes
So
today
the-
just on two that
Then we
had,
wouldn't offend the state attorney.
But we won't be able to
That
hear
twice.
Rory go through it and discuss it,
well,
which is a highlight for me.
We haven't seen as much of Rory. There was a while we were also seeing a lot of Rory. We haven't seen her in a while.
You could still ask, but I don't
So are
think
you
there's
trying
any
to
reason
say
on
that
area on it either.
The Attorney General and the respondent's attorneys don't even have to come. Nobody has to come. We can vote on them. Just you handing out a paper saying,
yeah, I mean, I'll send them to you just like I do
Well,
with
yeah,
everything else.
we'd look at the settlement agreement in our
and
information
email
sent
you
to
back
us.
saying, I'm in favor. Or,
No,
No,
we'll discuss
we'll do
it
it
at
during
the
the meeting.
meeting
oh, we'll still talk about it.
So
and talk about it and
Okay.
vote on it and
But it should
agree.
speed up
So-
the process because we don't have to.
So
listen to
everything is the same
presentation.
except that we don't need that.
Yeah, I don't go through the first 2.5 pages of reading the hearing script.
Seems like it'd be better
And you
for
don't have to do the
care.
script, you don't have
Yay.
to do any, you could do it two ways. You could either do them individually, or you can just say, now, nursing board has a lot more of these than we do, but I've seen nursing board say, okay, 1 through 5, yay or nay? And it was like, does anybody have any questions? No. Does anybody have any concerns? No. Yay or nay? And they
Nursing
just-
board doesn't sound like that board.
they vote on it, and then they go through the next 5 or 10 or whatever. I mean, sometimes they'll have 15 or 20 on there.
I would at least vote to do it individually.
Okay.
And if it's,
I mean,
if it's important enough
it's
to
only-
meet and do a settlement agreement, it's important enough for us to individually hear about it and vote, in my opinion.
What do you mean hear about it?
Well, we're gonna talk about it
Just together? Okay.
together.
Without them, though.
Oh, yeah, no,
Rory
no,
will-
I'm
Make sure we're
I'm
good.
well past
Okay.
making Rory.
I think, to be honest, I've been doing most of the settlement agreements for the last 9 years since the board changed, since you, Natalie came, and Steve, I don't know how long you guys have been on.
Yeah, we don't get the same time one
14,
meeting apart.
maybe, for me.
16.
I've been doing virtually 99%.
Was it 16?
And I think there's only been 3 that I can remember that you guys said, well, this wasn't enough.
I didn't even think there's been 3, but yes, there's been.
Well,
Very,
Joan was
very
concerned
few.
about the vet tech that let the dog die when I gave her some CE and stuff, because I felt like it wasn't her fault. The guy we should have went
It was
after
the
was the
vet.
boss, but
Well,
anyway.
that's why didn't we?
But, and then
Seriously.
Dr. Stewart, who told the board to F off.
Yeah.
My settlement conference got canned because of her attitude. And I think there was only one other. So it's only been 3 times that you guys have said Clementi screwed this up. So I'm serious. It's been in all those years.
Very infrequent.
Well, anyway, is everybody okay with doing it this new way?
Yes.
Okay, just making sure.
Because, like I said, there's been few and far between where there's been change.
Okay. Natalie, you okay with it?
I had my one thing, that was it.
I like that. We did still about the one, that's all right.
Dr. Marsh wanted a placemat for
I
the
know,
board, and I didn't create that. Denise and Jared did, our communications team.
this is good though.
So, and Dr. Shipman is involved in it as well.
In the short time he's been here, he actually helped with these?
Well, yeah, because he helps
Wow.
in all of his previous roles.
Do you have another, do you
I mean,
have another story to talk about?
He's basically been the interim the whole time I've been here. Dr. Marsh left right after I started.
It's true.
I don't need, it doesn't need to be green light on.
Outside of it.
For,
You want the floor for a second?
I don't, hey, do you all know about Jim Wiseman moving on?
Yes.
You all know that? Why
Well,
don't you do?
I do not.
Okay. Jim is our board of director, well, he's a delegate from 6th district, or whatever
Yes.
it is. It's
IBMA.
Indiana, Illinois, and Wisconsin. He sits on the board of directors of the ABMA. He has accepted a full-time job with the ABMA, being he's got a title that's 2 miles long, but he's gonna be in charge of all of the accreditation, overseeing COE and everything. He will be Janet Donovan's right hand. He'll be up on the 5th floor with her.
Schomburg.
Chief of Academic Affairs, Research, and Accreditation for the ABA.
Yeah, and I just heard last night, he does not have to move up there. He can do a lot of it virtually, and then he has to go up a few times, so. But I think I think it's great. Now, what that means is Indiana doesn't have a direct appointment to the board of directors of the ABMA. So what has happened, and I think it's
Oh,
going
yeah,
to
to
happen,
give that up.
we're going to, see, it usually rotates between Illinois, Wisconsin, and Indiana. They're gonna flip-flop this because there's 5 more years on his tour. So I think it's Wisconsin. Yeah.
Yeah, Illinois
It's
was the last
Wisconsin,
one.
it's Wisconsin. Wisconsin's gonna appoint somebody, and then, quite honestly, that gives Indiana the time to groom somebody to take that commitment, so I don't think it's gonna be too big of a problem.
Circle.
I don't care how you do it. You
Check
can
mark.
put a smiley
Oh,
face
check
next to it, check mark, circle it, initials. This is how we're gonna nominate the chair and the vice chair, is just whoever gets the most votes for each position. And then whoever gets the most votes for each position, the board will actually vote that person up or down. And then I think that Dr. Rodebarger might talk about liaison position and requirements for that.
Yeah.
Sure.
I remember.
We talked about it a lot.
I didn't know I was necessarily going to talk about it. Paul has voiced concerns about the volume of work that he has been presented with, and not so much that it's too much for him to handle, but that it starts to wear on him, and he potentially gets a little jaded in his attitude about some of the mistakes some of these people have made, and it becomes more problematic for him that way. But also that it is a lot of work. And I believe that a couple of people have volunteered to step up to get involved in that process. In making a decision of who's going to help, I think that the person needs to be a veterinarian, because if it is a veterinarian coming before the group and being involved in a settlement situation, being critiqued and judged by a non-veterinarian, I think would be a tough swallow for that person. And that's just my opinion, but I think there's some validity to that. And so, for example, let's say that Ashley would want to do this, and that's a wonderful thing for her to want to do. There could be some dissent over, gosh, what is an RVT to be able to determine whether or not I'm practicing good veterinary medicine or not? And so and that's not a critique on registered veterinary technicians or their wonderful education or their capabilities or anything like that. It's just kind of maybe like the politics of that situation. So what am I? Oh, I'm sorry. That's my thought on that. And so at this point, that this can be open to discussion, but if there is none, then I think Steve and Paul are going to share those duties, at least at this point.
And then I have a discussion. I
Sure.
totally see the validity of that, totally understand that. But is there a way, I'm just interested in learning about it, not necessarily sitting in front of someone and going over things. Is there a position, not like a position, but just like a job shadowing thing where I can see how it's run and how it works? That's my interest.
Paul, you want to speak to that as far as
Yeah.
having an extra person in the room or whatever to be
Yeah, like
able
an
to?
assistant.
Well, when we review these cases, when I review these cases, just to give you 2 seconds of history, when I first came on the board 14 years ago, there were 2 veterinarians as reviewing cases, Patty Kovach and Robin Walsh. And whenever they were replaced by John and Steve and yourself, I don't know what year that was, but somehow when that happened, it fell to me to be the only person reviewing cases. Instead of 2, there was just 1. And when I went to the ASVB meeting in San Diego, AASVB, you know, these other boards were saying, well, we have like 3 people reviewing cases. So not so much that I'm retired, I do have the time, but there's 2 investigators now at the Attorney General reviewing cases. And so I'll get sometimes 3 cases in 1 week. And by case number 3, I'm like, this veterinarian needs to be shot. You
How
know,
many pages
I mean,
are those?
it's not that I can't do it, but I found myself getting really jaded, maybe a little bit edgy, you know, and I don't want it to cloud my judgment, and I don't want the rest of the board to think, well, he's unilaterally doing all this stuff. So that was my thought, is potentially one of us could work with one investigator and the other with the other. That's all, just so that there's another set of eyes looking at some cases and doing some settlement conferences.
And back to her question about being able to.
Yeah, it's hard to do that because you got to try and keep it somewhat confidential.
Yeah, that's true.
Because if I review a case and you see it and you see it, and now we've all got prior knowledge, if 3 of us have to recuse ourselves, we've got a problem.
Yeah.
You know, and so that's where I think having 2 and having them split, then there's only 1 person. So if you review a case and they decide to do a settlement conference, you can recuse yourself when that comes before us, if you don't feel comfortable voting, like I did with Dr. Gupta today. Only 1 of us had to step aside. It hasn't been a big problem lately, but when we were shorthanded on this board, it could have been a problem. There were times we only had 5 members.
I think logistically, you kind of do that at home too.
It's all done at home.
How many pages are those reviews?
Well, it just depends. I'm training Cassie,
I
the
know.
new investigator, a little
Cut
bit,
it down.
because
Because they're like
she would
25
write,
pages.
she would write like a 10-page case summary and send me all the records for the animal's entire life, and it's 12 years old. And then it went to MedVet and all of those, so all of a sudden I've got 65 pages to go through for 1 case. Now, quite honestly, I learned how to skip chunks that I don't. It's not that bad, it's just, like I said, I felt myself getting, you know, I mean, dog spay, for instance, today. And it's like, what were you thinking? So if someone could share the liaison responsibility with the Attorney General, that helps a little bit.
And are you
Not
okay
just
with
from a
that?
time standpoint.
So historically, the vice chairperson is the liaison. So what I thought we would do is do the voting of the chairperson and the vice chairperson. And then if there is an additional liaison who volunteers, we can vote on that to just kind of
Things legal.
make things official as a second liaison. If you voted for 2 people for vice chair, I need that vote to be 1 person.
It was me.
Okay.
Who decides?
But yeah, I don't know when you guys came on the board. I don't remember.
16.
16.
So I've been doing all the cases since then, right?
Yeah.
8 years or so.
I think I can give you the exact date.
But I remember when Patty Kovach and Robin used to split them up. And Cindy would always be upset with Robin because it took her too long. And Patty was fast. I mean, I usually give them an answer within a week or at most, sometimes the same day. And when Brittany was doing it, she was going, "What are you doing, sending me stuff at 1 in the morning?" I said, "Well, I have insomnia."
And then I got insomnia, so I started replying at 2 o'clock in the morning. That's what I did.
We all started 7/22/16.
And Laura Turner would text me at 4 in the morning. I had to hide her alerts because she went to bed at 6 and got up at 4. I'm just telling you a fact. She would not deny it. The first few times she did it, who is texting me at 4 in the morning? But that was her schedule. Bed at 6, up at 4.
That's crazy.
Okay.
Okay, so we have the official tally. I'm gonna, I guess, run the vote since Dr. Rodenbarger is
On the ballot?
the nominee. So we have Dr. Rodenbarger received the most votes for chairperson with 7 votes. So can we have does anybody make a motion to have Dr. Rodenbarger be the chairperson?
I motion to nominate Dr. Rodenbarger for the chairperson.
I'll second that.
And
You're doing a good job.
Yeah, I was willing to keep doing it.
And then, do we need to do a roll call then? Or just a straight vote?
We've never done a roll call
Okay.
before. We just.
Okay, all those in favor?
Aye.
Opposed?
You're doing a great job.
Is that a real?
No.
Okay.
I voted for myself. As
I
embarrassing as that
Well, you
is.
nominated, but you could have objected to the final vote.
That's all right.
Okay, and then Dr. Clemente has the most votes for vice chairperson. Does anybody have a motion to make Dr. Clemente the vice chairperson?
I do.
Okay, Ashley, and a second?
A
Hillman?
second.
And then all those in favor?
Aye.
Opposed?
I'll abstain. I'm fine.
So, congratulations, Dr. Rodenbarger is the chairperson, and Dr. Clemente will be the vice chairperson. And then, does anybody, well, Dr. Sunbury, do you still want to be the,
I would be
Second
willing
liaison?
to help out if,
Do I need to nominate him?
Yes.
I make a motion to nominate Dr. Sunbury as the board liaison position,
second liaison?
second in line to the vice chair.
I second that.
Okay, and all in favor?
Aye.
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 Opposed? All right, Dr.
Steve's being
Sunbury's
awful quiet.
the second
I can't believe
liaison?
you did this. I voted for you for vice chair.
80,
too. It didn't
80,
fly.
how many pages?
I voted,
Like,
I voted for a couple people.
like Natalie said, that train has left the station.
No, that's an example.
So we can talk, we can discuss.
I've known you long enough.
We can discuss this further between Dr. Sunbury and Dr. Clemente on email or telephone call. You guys can decide how you want to split them up with the Attorney General's office, and I can forward that information. I can have them send all of the board summaries to me and then I can farm them out, just whatever you guys want to do, just let me know.
Yeah, I mean, it really doesn't, I joked a little about Cassie. She's pretty good. She's newer at it than the other Brittany that was here today with she's been doing most of it. She still does most of the investigations and case summaries, but when they added Cassie, then they were coming fast and furious there for a while. It's tapered off since the holidays, quite honestly.
Well, I think that they will taper off once they get an idea of
Right.
what these cases look like, and they'll remember, oh, okay, he said previously with similar facts that this was not something that.
I mean, you've been
would be
doing
charged.
this long enough, it's just, at the end, I'll say, in the past, the board has done this, I would recommend the Attorney General consider, I don't tell him what to do, I recommend the Attorney General consider a letter of reprimand and 6 hours of additional CE. And Rory, who's become the chief attorney for most veterinarians that come before this board, 9 times out of 10, she wants a settlement conference. We don't see very many live hearings anymore.
Do these people seek her out, or is she recommended as?
Her agency,
The insurance company
Okay.
retained her.
Okay,
yeah.
I was wondering how that happened.
Insurance
ABA
company like that?
insurance.
Yeah. She's under PLIT. I think,
Get a hold of AABS.
They do.
I believe
And
so,
see
yeah.
where they're
I
at
felt
with
bad.
their
Yeah.
task
People here, I'm
force
like, you
to
should
put a vet
ask
tech on every
Rory.
state force.
Because we've had a couple of breeds come here, they very clearly don't do like
Cause I haven't heard anything about it, have you
It's
heard
like just a
anything
weird
about it?
interesting.
No.
and You should ask somebody who knows.
Cause that's a task force I wanna be on.
Well, what?
Okay, so I haven't given my board report yet, and I will make it super short because you guys already have all of this information. The biggest, one thing that I added was settlement conferences and kind of a liaison activity. If I had more information on how many board reports you guys are getting every week or quarter, I could put that on here just so everybody else knows how much is being done. I say Dr. Clemente did 2 settlement conferences this quarter. I think he did 2 and 3 the previous quarter.
Over the course of this summer, I think I did like 4 settlement conferences, but I reviewed something like 11 cases in June, July, and August, which was unusually high activity. To
So
have that many in 3 months.
Something to look forward to.
additional information, and this is on that placemat as well, but over in 2024, the average application processing time from the time the application was submitted until the license was approved and initiated, the average for veterinarians was 49.29 days, which was a 36% decrease from the 2020 through 2023 period. RVTs, the average processing time was 47.22 days, and that's a 42% decrease from the 2020 through 2023 period. I just chose 2020 through 2023 as kind of like the immediately preceding period. And then I wanted to say I will be going to Kansas City, Missouri at the end of March for the AAVSB Executive Director Spring Summit and Board Basics Conferences. And then the annual AAVSB meeting is in Cincinnati in September 7th through 20th, and Dr. Shipman and I plan to attend that. There is a call for nominations packet in there in your supplemental director's report. If anybody wants to be nominated for anything, there is kind of a timeline, and we'll want to vote on that at between the next 2 meetings, I think. If you're gonna put anybody up from the board for a nomination to be on an AAVSB board. And then just briefly on the audits, 4 DVMs were suspended for non-compliance. 1 was reinstated after paying the civil penalty. He did that pretty quickly. I've got 2 people in Puerto Rico whose green cards were returned, but I haven't heard from them. and I have one green card on the suspension, both of these are suspensions, sent to Illinois, and it was sent back as non-deliverable, so I don't know if we have that address for her.
Green card is not.
No, it's the certified mail. It's
All right.
literally
Oh, okay,
green. Sorry.
Why are we
Nope.
worried about that?
No, you don't have to have a green card for Puerto Rico, I don't think anyway, since it's a US territory.
Do we actually have a Puerto Rican national that,
They're US citizens.
well, I know, but
We have 2 people currently living in Puerto Rico
That maintain license.
that have a license. I don't know when they moved to Puerto Rico. I don't know. And then RVTs, I've got 8 RVTs in noncompliance. 6 will be suspended on February 14th if they remain in noncompliance. I have 1 that will be suspended April 29th if she remains in noncompliance. And that was because I had to send out a notice of noncompliance because I didn't have any evidence that one was actually sent out. And I have 1 under a payment plan for their civil penalty. So happy Valentine's Day.
Happy Valentine's Day. That's what I was gonna say. All right.
Oh, next meeting is April 24th. Is that good? Just say yes, and then
Yes.
we're
It's a
done.
Thursday, correct?
Yeah.
Okay, so we're gonna keep with the
The
Thursday.
funny part is there was a nude meeting, I had the option to join today, and I was like, I'm not doing it.
Meeting
Adjourned.
adjourned at
So
Thank
Ashley,
you,
did
see
you
you all
want
in
to
April.
hear
I have to
a
take